time out of your day. This is the Wednesday, April 8th, Health, Social, Educational, and Environmental Committee meeting that I am officially calling to order. Tonight we have Legislator Rian filling in for Legislator Adnesio, and our thoughts and prayers are with her and her family. Unfortunately, she lost her father and served New York City Police Department for 20 years, and we appreciate his sacrifices and all he did for his community, and we're very sorry for our colleague, Legislator Adnesio, tonight. So before we begin, I want to thank you all for being here again. Legislator Russo, can you please lead us in the pledge?
Sure.
It's on this side. I can't get used to that.
I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. So first on the agenda, we have item number 3, which is a discussion and an update on Putnam Hospital. And tonight we have to, roll call, please. Thank you, Mary. We talked about this earlier, how it'll be a basket case.
Legislator Adnesio, Legislator Russo,
present.
Chairwoman Montgomery.
Here. Great. So we're so pleased to welcome Putnam Hospital President Dr. Mark Hirko, who is here to provide an update on the hospital, including recent developments over the past year. Welcome. It's been a while.
It has been
Thanks
a while.
for being so generous with your time.
No, we appreciate it. And as you know, from our previous conversations, we really think it's important to keep the word, keep communicating and get the word out, that we're, things are moving forward. There's a lot of change underway. We're 1 year into the merger with Northwell, and we're starting to now see some of the changes being implemented. You'll notice as we hit the summer that the new Vance name will be beginning to be sundowned. So they'll be changing the external signage. So our name now will be Northwell Health Putnam Hospital. There'll be no more center in the name. So that's the official name now of the facility. And there'll be just a lot of things starting May 1st, which will be our 1-year anniversary, going over delineation of uniforms within the facility, working with various services such as security, our ED, et cetera, as we go and kind of change over to Northwell. So, it is a big culture shock across the board when you go from a 7-hospital system to a 28-hospital system and 105,000 employees. So it's there's a lot of resources available, and at the same time, a lot of things that they do that are there to assist us and help us move forward. And with that, just as an overview for the past 9 months, we are really having one of our better years. Since I've been here, this is the best year in regard to financials, volume. Our ED volume pre-COVID was running around 15 to 16,000 patients per year. We just missed 24,000 this year. So despite all the urgent care centers coming up, we're getting busier, if anything. And the good news is that our quality and our throughput is much improved. We're one of the best in the system in all of Northwell now in regards to if people come in and need to be discharged from the emergency room, we're very quick about it and very safe. So that's a tribute to the team that's working there. Women's health is another area. We went through that downfall or the downward trend in 2022 when the OB group left. And after a 9-month hiatus, we reopened. We're scheduled this year. We're on target to hit over 100 births this year. And if we look at our quality, which is important, our niche is to be a high-quality, low-risk birthing center. And that's pretty much the niche that we're fitting. Occasionally we have people walk in. I mean, we just had the day before Easter, one of our pharmacists who actually was high risk following somewhere else went in the full labor at work. and had to deliver there, but she did very well. So it's the team really is solidifying, and we're seeing and bearing the fruits now. People by word of mouth are coming over, and it's getting busier. Where we're really seeing the business for the women's health program is actually on gynecology. Since we're an aging population, we're seeing a ton of business and a ton of people trusting our doctors as we go forward. So that program is really flourishing. We've had a marked growth and a rapprochement with Somers Orthopedics. They have a lot of new young partners and young members of the team, and our volume has almost doubled in 2.5 years with them, and it's getting busier. So I'm actually tomorrow having a meeting with them to kind of go over future state and what equipment they're going to need, because they have enough docs to cover both northern Westchester and our county, plus their surgery center over in Connecticut. So this looks like a great opportunity and a win-win-win for everyone involved. So really encouraged there. We've, general surgery-wise, we've just added or offered a contract to a new surgeon. So that'll help as we get busier with general surgery, so that's coming along. We've renovated 3/4 of our ORs, and we'll be on pace for June 1st to have the last one renovated.
What's
So
an
all
RO?
12.
What's an ROR?
Oh, the operating rooms.
Oh, ROR.
Yeah, sorry.
Oh.
ORs. See, I ran into slang. I always get on people about the slang, so sorry about that. But yeah, the operating rooms, the whole facility, since I've been there, really has needed an overhaul. We had a lot of neglected infrastructure, and I want to thank the county and the electrical company for helping over the past year when they added the second electricity access to the facility. So that gives us a good, strong backup, so we're not seeing as many outages as we had in the past, and it really was killing our generators. So we have new generators. We've purchased the office building as you come in to the right of the facility. I don't know if people knew, but we didn't own that building. That was owned by a private equity group. So we finally have purchased that, and now we're busy renovating that building and adding more practices there. Behavioral health has been very busy in the inpatient realm, and we're having a very good relationship with Dutchess County in regard to them triaging patients that may show up there that are actually from our county, and they call us, and we're able to accommodate them and transfer patients over. Where we see the biggest need, and this is across all of Northwell and all of this part of New York and Connecticut, it's lack of adolescent beds and pediatric beds. We may board an adolescent or pediatric patient for up to a week at times because in the whole general area along the East Coast there's a shortage.
Is that for just general
Psychiatric reasons.
Not just general med?
No, through our area we don't have very many pediatricians, so therefore our pediatric practices are quite limited throughout. But the psychiatric needs are getting more and more prevalent. So we're working with the larger health system in developing a long-term coverage model. So we're encouraged there. All other areas of growth will include cancer care. Our one oncologist did leave the region, and so we're in the midst of reestablishing that growth and the momentum we had earlier, and we've had many good candidates come through, and that's in the meantime we've been busy working with our advanced care practitioners performing chemotherapy and stuff like that. So the volumes are still there. We just need doctors there for new patients, and that should be coming before the end of our fiscal year, which is October 1st. So that change will be coming. Other areas that people say, well, what are your concerns? What keeps you up at night? A lot of headwinds in regards to Medicaid and Medicare. Medicaid particularly, we don't see very many Medicaid patients other than in our emergency room, but throughout the health system, there is a marked gap in regard to people that have lost healthcare insurance that now show up in the emergency rooms or require care, and the reimbursement is minuscule. So you'll see a lot of hospitals actually, they're not caring for patients other than if they have to through the law. But otherwise, there is a marked gap, and it's causing deficits throughout almost all nonprofit hospitals today. So that'll be something you'll see more and more. It's one of the reasons that we saw this coming. Why it was better for us to merge with a larger health system who had the wherewithal and deeper pockets that can maybe handle some of those losses that occur. But that's something that we've got to watch as we go forward in the future. And there's still the implosion of the Optum Medical Group locally. About 30% of the docs have left the region and left that group. And so we're busy scrambling at Northwell, Nuvance, to actually hire physicians to fill that gap. But the statistics show that, for every 10 people you hire, you keep 7 after 3 years. So if you keep looking at the math, and we've estimate we're about 55 primary care docs short just in our region. It's going to take 6-7 decades before I think we fully catch up. So it's one of those things that other management and other tools using AI will be things that will be noted in the future to help assist caring for a lot of patients, including telehealth. So we're moving forward there. I think, let me go over awards. We are a Leapfrog A safety hospital, so we were noted to be safe. This is our 5th rating period in a row. We're a Leapfrog A. And when I first came on in 2022, we were a Leapfrog C. So it's good to see that we've been able to keep this up, and the changes we've implemented are working. We're a CMS 3-star hospital, and there are 5 stars, and we just missed the 4th star. It'll take us a while to improve that because of the infrastructure needs that we'll have. And as we look in the future with Northwell, they're currently implementing a new electronic medical record, which is one of the most popular in the United States. And they have 27 hospitals before us. So we're probably not going to see that integration occur with the electronic medical record at least until late 2028 or early 2029. So in the meantime, we have a lot of stopgaps and interfaces set up to keep the communication channels together. And then, we're working with our medical group with Northwell integration leadership teams on a daily basis. I have a half-a-day meeting with them tomorrow just to kind of, as they look and do a deep dive at Putnam and look at what's the future hold for our facility. But the more I see where we are, we're going to maintain being a community hospital that offers, general surgery, orthopedic surgery, some specialty surgery, comprehensive women's health, a very strong and viable emergency room, and a very strong behavioral health program. And the area of we'll be picking and choosing will be our cancer care, depending on the types of specialists that we're able to bring on. But again, we don't want to be redundant when we're surrounded by 4 of our other hospitals in our own health system within 30 miles of us. So we have to be careful with our resources as we go forward. So all in all, I'm encouraged by what we see. Our employee retention at one point during COVID was at 48% for first-year employees. We're at 87% now. So the people that are coming on are staying on. So that is a tribute to our leadership team that we've brought on, that people are working with the people that are coming on and the new generation, understanding that there is a difference in expectations, and then we're working on in keeping that patient flow and quality going. So I think with that, I'll stop.
Yeah, thank you for all that. I think you actually answered a lot of the questions that I had here, and the growth demand that you noted. My question, I think you answered, is keeping up with, the growth is your need is hiring more physicians. I don't think infrastructure is so much of that growth demand.
No,
Doesn't sound like,
it was
'cause you got the
interesting.
building across
We
the
were
street.
running, well, even in our facility, when I came on board, we were probably running at 35%.
Mm-hmm.
So we have very good bones.
Yeah.
And so the job is, what do we do with some of the stuff? We don't need, when the hospital was built, it had almost 300 beds. So we're licensed for 164. We usually use about 80, 75, 80. So we have a lot of infrastructure that we can convert to other things. We just need to know what it's going to be.
And the demand is for staffing, it
Well,
sounds like.
It's staffing and then knowing what the community has to offer. And that's the one thing, the expectations of community, everybody wants everything local. It's hard when you have
Well,
a community hospital.
Yeah, knowing what I know and working in government, the number one thing always from the beginning of time since I started working is that issue, that very sad issue that you bring up about the lack of adolescent and pediatric beds. And we don't have it. And I don't know if there's a plan in the future, if you guys are setting things in place to try to plan for that. I would be curious about what your plans are for that and what they are for the Medicaid issue. And are you guys meeting and discussing and coming up with a plan for how to address that?
Well, the peds for sure, but just know that especially for any inpatient beds for peds, you have to have a certificate of need, and it has to be approved by the state. So I know we have a hospital within Northwell itself, and then there's really nothing else other than the hospital in central Connecticut. So because they're really tight about where they go, and then there's one in Albany. So we're eagerly awaiting to see working with Northwell, where we fit in that regard, and where a possible location could be for more pediatric beds in the future. I just don't know where it would go.
Thank you. I'd like to open it up to the committee for any questions.
Thank you for coming in. I appreciate it. I appreciate a lot of the updates. Is there any plan for re-educating Putnam County residents that you are back with, maternity, and I know you said there's 100 births, but I still do hear from people like they have to go elsewhere because of what happened, a while ago with closing down the maternity. And then everybody wants to go to Danbury. So is there a way that we could re-educate and let Putnam know that you're back up and running, you're going to be a larger hospital?
Well, again, being with Danbury, Northern Westchester, and Vassar, all within 20 miles. Well, Vassar is closer to 30, 35. But if you look at the other two hospitals, they're tertiary hospitals and they're academic centers. So they're always going to be the ones that are going to do the high-end cardiac procedures, the acute heart attacks, the high-end cancers, the major traumas. So that's not going to be done here. We just don't have the resources for that. So we are educating the community. We go out, as Marcella can attest to, who works with us, with our communications team, we really go out and explain where we're going with things. But people remember the old days.
Right.
And we just can't do that anymore. We have to be very strategic about the services we offer. And that's why a community hospital is a perfect setting for us. We're really good about recognizing who should stay at our hospital and who needs to be transported immediately. And we're working even with Northwell about having a greater presence of Northwell EMS in this area, because transport is a major problem for us. Just the county is stretched and the local ambulance services are stretched. So we are really working hard to really bolster that. And we'll keep working everything else. Regarding women's health, again, we will be a low-risk center. We don't have a neonatal intensive care unit. Because of that, anybody who is considered any risk has to deliver those centers. So that limits the people that can deliver here.
Thanks.
So, sure.
Hi, Dr. Mark. Welcome. Thank you for being here. Not sure if you recognize me, but you did, right? Over a year ago, I was wearing a blue uniform shirt, and I was working for you. So you and I could go on till 11 o'clock. We're not going to do that here tonight. We're very late. So I'm going to limit my questions to what I think directly pertains to county business. And you talked about the mental health unit, which is always during the legacy, it has been a challenge, right? how many beds do we have available now in the mental health unit? And are there any upgrades planned for the fourth floor?
We have 20 beds, and we run around 85% occupancy, closer to 90 lately. So, and then at any moment, usually we're boarding 1 or 2 people in the emergency room, because we have 2 rooms there that are psychiatric evaluation areas, because we get a lot of transfers from other hospitals.
Thank you. And yes, you had said that about the boarding before, and just for everybody's explanation, and it's unfortunate, it's tough sometimes, but boarding means you're waiting in the emergency room until you can find a room somewhere else to take care of somebody, and that could be a very difficult situation for everybody involved. But when they're youth, there's not much you could do. I'm aware of that. But so thank you. And the mental health unit pertaining to the county is definitely true. The morgue, sir. We have the coroner's department. The morgue has supposedly being updated for the last 5-10 years. We've heard that upgrades were going to be done to the morgue. Is there any progress with redoing the morgue?
We've done basic upkeep per my conversations with the coroner, that all the changes that they asked to be implemented were implemented.
Okay.
And I had a recent discussion in mid-January, even regarding the reimbursement of the deaners that come in to assist for the autopsies that are approved. And we can fit, I think, six or seven bodies, and normally we're 2 or 3. So, and there hasn't seemed to have been an issue, but I can follow up on that.
That might be a legacy question. There might be improvements since last time I saw that. And lastly, the diversions that sometimes come out from Putnam Hospital. In a different career I have, I get a text occasionally when Putnam Hospital is on diversion. How often does that happen? And do you get notified when that does happen?
I do, and I have to be the one to approve it.
Okay.
So it's extremely rare. The last time that I placed us on diversion is when we had a lightning hit, and one of our generators malfunctioned. So we were on temporary generator for about 8 hours until that was corrected. Most recently, we had an issue with we had a patient from the Transit Authority came in and set fire to one of our psychiatric evaluation rooms.
Right.
And the fire chief, for prudence, put us on diversion for about 20 minutes or so. But even there, in retrospect, we could have done better in regard to the communication to avoid that. But otherwise, it's extremely rare, because I usually have to call my bosses to be placed on diversion. So it has to come through either me or one of our senior leadership team for that to occur. So the days of the old days of going on diversion all the time, not going to happen.
And that's the magic of staffing in the ER, which is one of the most incredible tasks in the world. Despite historical data, you never know when you need 8. You never know when you need 16 staff members in an emergency room. It's impossible to predict,
It is.
except full moons, right?
Yesterday,
Full moons.
we had close to 80 patients in 8 hours. So it really, and you know what's really impressive, and that's why I really want to thank the team. At one point during COVID, we had a walkout rate of close to 14%. And as from staffing and just from the waiting times. Lately, we're running at 0.2%. So it's rare that we have people, walking out on us, unless they come in with an issue that they realize they don't need to be there, and they'll just walk out. So I'm really thankful for the team.
Thank you so much. You and I could go on all night, but thank you for coming here. I'm going to defer.
Thank you,
Anybody else?
legislator. Any questions from the legislators?
Just, if I could, just one quick question. What is diversion? I'm just not familiar. I'm a layman. I don't know what that
Sometimes we can be overwhelmed in the emergency room, either from maybe if there's bad weather and there's no way ambulances can get in, or if we lose power, or if we're completely full, then we have to actually notify the state that we cannot take patients anymore. Then the ambulances for all emergencies have to divert. Because it really is a difficult thing, because to communicate all that out and get people en route and move them around. So that's why it's very rare that we'll ever approve that.
Okay, thank you. It just puts that in context. Thank you for that. Thank you.
Great. Anyone else? Any legislators? Anybody from the public? Well, thank you, Dr. Hirko. We really do appreciate you being here and the work of you and your team, all that you're doing. Oh, Bill has a question. Yes.
Sorry I came late. I might have mentioned this already, but do you have any plans to do anything on the west side of county Phillipstown, Putnam Valley?
We have looked multiple times, and we've done survey, even surveys, that we've done deep dives, and now even with Northwell, we're looking again. And we'd love to do more, but we've even checked with where the patients go, and tell you, when you hit the mountain, anybody west of the mountain, they go Peekskill. They'll go to the Hudson Valley. Yes. And it's rare that they'll come over the hump and come over to us. And then when we looked at other, we opened up practices, and we actually absorbed a practice out in what's the
Phillipstown.
Phillipstown, or Putnam Valley, excuse me. And the patients all to a T kept wanting to go more toward Peekskill
Yeah.
rather than
And
us.
that's where our ambulances go, or they often go to Vassar.
So this will it'll be a major change or an issue down the road if it ever changes. Now, I know Northwell is more aggressive with trying to build things. Where I see the growth more so in the near future for primary care, it's going to be on the east side near Somers and Mahopac. I see another practice going in there. We've added 13 primary care docs in the last 3 years, and they've been in Brewster, 1 in Carmel, and then now 5 over in Mahopac. And that practice is almost full, so we're going to need to build eastward a little bit there too. So we'll keep looking.
If you come in Mahopac closer to because Mahopac, on the western side of Mahopac, it's kind of part of Putnam Valley in many ways. If you have some kind of practice closer to that area, you will generate people from Putnam Valley that come over.
We'll keep looking, and we're working, and that's why now that we have more resources to look at the long-term data and travel patterns with Northwell, they're really starting to work with us to look at other alternatives, and this could be one of the alternatives. I won't.
Thank you. Really appreciate your time.
Thank you.
Thank you.
Thanks so much. Thanks for being here. We'll see you, I don't know, in a few months. Will you come back? 6 months. Okay. We really appreciate it. Thanks. It's all good
Thanks.
news. Thank you. The next item on the agenda we'll move to is an update from the Department of Health on the PFAS private well mitigation pilot program. And I'd love to bring up and introduce Health Department Director Rian Rodriguez and our Public Health Sanitarian Brian Stevens, who is heading up this very public project.
Good evening.
Good evening. I spent some time, I deal with PFAS because I fish, and we had to go through the whole waiter experience, and people are upset that they can't get their Sims waders, kind they want anymore. But for anybody who doesn't know, PFAS is short for polyfluoroalkyl. Is that correct?
Correct.
It's an interesting word, substances, and they're man-made chemicals that are used, and they've been used for decades in products like cookware and waterproof fabrics like fishing waders and firefighting gear. So just thought you'd appreciate that. So how are we doing?
We're doing well, and I guess it seems appropriate that we're meeting during Public Health Week. I think it's great that we're sort of bringing up this subject, especially since this body was key in terms of supporting us participating in this program. Just sort of as a reminder, we're sort of one of 6 counties that are currently participating. They're sort of opening up during different periods, but we were amongst the first. We actually launched March 9th, and the uptake has been significant. It's my understanding that at this time, both Dutchess and Ulster have paused applications for testing at this point. There seems to be a soft cap of about 600. So both those counties have met that threshold so far. And the
Less
last,
than a month, right? And less than,
correct.
wow.
And we currently stand at 360.
Wow.
So I guess I know sort of one of the questions that that sort of came up was around the funding. And you are correct, there is $1.5 million that has been allocated for this. the $300,000 was basically just an equitable distribution amongst the 5 years that the program was anticipated to be around for. But if things keep going in this direction, a lot of these funds will most likely be exhausted way before then. But once again, this is proof of concept. The idea here is we can use some of these learnings to see what perhaps the state can do to create sort of broader mitigation programs. Understanding that this is sort of limited in scope. There's testing component and criteria, but this is at least a tool that we now have available for residents and their private wells to both test, monitor, and for those that qualify, put in a mitigation and get a rebate associated with that mitigation system.
Great. I mean, I see Brian still standing, but with that news of over 300 in almost a month, I guess my question is staffing capacity and oversight, and are you okay?
I think at this point, we haven't gotten to fully into the process of receiving rebates and going through the whole process. This is actually the first week that the state contractor will be sampling wells in Putnam. So once they start that process, we expect 1 to 2 months out. Those results will start coming in for those residences, and then they'll probably take about a month to put on treatment. So we should see those rebate applications coming in 2 to 3 months.
And do you have to administer that? I mean, your part of it is, I think, very public, and you're the front line.
Well, our part is more making people aware of the program and processing those rebates.
Okay.
That's where and the calls that do periodically come in when people have questions about the program or need assistance with the program, either signing up for the program or, who they need to contact to participate.
Great. And you think you have the capacity to do that right now? You know what I'm getting at.
I would say, part of this is a new experience for us. So
Yeah.
we're trying to sort of understand what this will mean in terms of bandwidth for us. As Brian's described, a lot of this initial work is sort of front office staff work. And that's really in regards to, getting the applications initiated for residents that have questions. That staff will actually be training April 28th. Because now they need to learn what the platform is going to be. There is ultimately going to be a dashboard associated with this, so we can track information as well. So we're getting a better understanding of what needs to happen both at the front end and then also sort of in terms of field staff. So although the state, in terms of contractors identified or labs for monitoring, there is going to be a need for our field staff to be out there to assist. So we are trying to get a better understanding of what that means. So, we do have some considerations that we're making, and I'm sure I will be here in front of you all as part of the Personnel Committee meeting to have a more detailed discussion of what that all entails.
Yeah, I think the tracking idea is interesting, and I wonder if perhaps you'd come across clusters, and from a health department perspective, if that tracking is showing a cluster in certain areas, that's another whole
Yes,
thing
I think
you're
that's
gonna.
part of the whole pilot program. Right now, as the health department, we regulate, the community supplies, the transients. They're more office building and restaurant type areas, plazas. We don't have much information on
Private.
the neighborhoods, and so as information does come in, depending on how that's presented from the state, we should be able to have additional information.
That's wonderful information to have. Thank you for doing that. Are there any questions from the committee? Any questions from any legislators? Yes, Legislator Sage.
Thank you, through the chair. I'm curious about, I know in my district, the Mayapack Business District, has been identified as a PFAS Superfund site by the state of New York. What about the single-family homes around the business district? Because it would appear that you would think it would be the water supply in that area. So are the homes also affected? And would they qualify for this?
So they certainly qualify to be tested, and there's a lot of research currently around, how PFAS sort of moves through the aquifers. But the current recommendations are still that all private wells should be tested individually, but they certainly, should participate in the program, and if they do qualify based on their individual count for their private well. And that's unfortunately one of the broader limitations here is that it's for, residential private wells. But, if they, meet the threshold, then they certainly would qualify in terms of having the monitoring as well as the mitigation rebate, program available to them. So I would certainly encourage them, while we're meeting that threshold very, very quickly, to attempt to participate.
And how do they find out? How do homeowners with
Initially,
septics find out?
Through the-
Or wells, excuse me.
Through Health Ed and Shanna, we did a news brief, which was covered by, other media outlets picked that up and amplified that message. We've done some social media posts that they do have good information that is reaching a large number of people. And we did add it to our website, the county website, and specifically the health department website, so people can have access to that information there.
It's getting a lot of traction on social media.
Sure. Speaking of Facebook, Facebook post has generated 3,600 views, 6 reactions, 2 saves, 9 shares, and 15 link clicks. It appears Instagram, there were over 221 views, 8 likes, 2 saves, and 1 share. And on X, there were 29 views thus far.
And that's just your Facebook, right? I shared it on mine.
County website.
Lot-
I guess I have to do that.
Yeah,
Every time.
that's awesome.
County website.
Great. Sure, Legislator Regan.
Thank you so much. Thanks, Sharon. Quick question then, based on that, would a person have any reason to hesitate participating in the program? Like we said, as far as the mitigation is concerned, if you participate in the program, is it possible that your well could be shut down or no? Are there any reasons somebody would hesitate in participating?
No, not at least the initial testing to find out whether or not, what your levels are.
Okay.
I think Legislator Birmingham expressed last time about what would happen with that information. We'd be required to do testing, put on treatment, and that's not a part of this program. You're not required to put on treatment if you go through the process and realize that treatment is too expensive. You don't want to use the rebate to put that treatment on.
Okay, thank you.
Wonderful. Any other questions? Legislator Goldman.
Thank you. This is for private wells. Do you see anything in the future for group wells, for condos, and, subdivisions that have multiple homes that all use one well? You see anything like that in the future coming out?
I would say that the state is going to sort of utilize this as proof of concept and and one of my concerns is this is generating a lot of interest almost immediately, and scale then becomes of concern. And the financial burden associated with that. But I do think that the state seems to be interested in seeing what they can do to address this. There is probably some additional value in trying to address this at a larger scale scope, where you're sort of looking at systems that distribute to multiple homes. So I can see where, programmatically, there's the ability to sort of make that rationale, but there's nothing that I'm aware of that's being spoken about currently.
Yeah, I understand the people being concerned about this, because with the chemicals, everyone uses chemicals on their lawns, and most of the percentage of people in Putnam County have wells. Where there's no centralized system. So you're concerned that, your family or you are drinking water. That's why everyone's drinking, bottled water nowadays, for that reason. So, yeah, I can understand, what you're saying with that.
Which are usually in plastic containers, though.
That's another discussion.
I drink well water.
So if PFAS weren't enough, it's the microplastics as well, right?
Tommy said no PFAS in Guinness.
Just saying, just saying.
Any other legislators? Anyone from the public have any questions? Oh, well, thank you. Your work on this program really has an impact for residents, and I really appreciate you putting this together and, finding access to testing and resources. So we look forward to an update in a few months, if that's okay.
Sounds good, and once again, we thank you for your support in this regard.
Thank you. Great.
Thank you.
Wonderful. Okay, item number 5. We have a fund transfer 26T06 with the Early Learning Center. And we welcome our Health Department Fiscal Manager, William Orr. This is to better reflect how services are currently being delivered, specifically shifting it from itinerant services to care provided at private institutions. So,
Special education itinerant services,
Yes.
That's what it is, that's what it's called at the institution, yes.
great.
It's, that's under the institution line, those services. So, back when we first did this, when we had no kids, we thought they were gonna be all itinerant, but they're not. Some of them, a good 30% are see-it kids. So this will work it out so that we're paying the right expense line. So it's fiscal impact zero, it's just moving money over.
Great, thank you. I don't have any questions. Any questions from the committee? Any questions from the legislature? Any questions from the public? Great, I make a motion to approve the fund transfer 26T06 with the Early Learning Center in the amount of $250,000, and thank you for your time.
Second.
All in favor?
Aye.
Thank you. Okay, next item. Item number 6 is the approval of a budgetary amendment 26A023 in the amount of $23,084 for the Department of Health to adjust their budget to account for a state performance incentive award. This basically allocates those funds toward equipment, training, and public health program support. And again, I don't have any questions. You want to expand on that?
No, you said pretty much what I have right here. You know, it's the 13th year.
Sometimes I understand these budget transfers.
That's good.
Most of the time, not.
No, so, yes,
Great.
I don't know if you want to say anything.
No, I think this is indicative of sort of our priority around education and training for our staff. You'll see a little bit in there for some colorectal screening kits. One of the things we're trying to address is early onset of colorectal cancer. I'm sure you're all sort of hearing a lot in that space. As a colorectal cancer survivor myself, it's something that I take to heart. So, there's a little of that funding that we put aside to make sure that we're ultimately going to make screening modalities available for individuals that don't meet the traditional screening guidelines currently. And then, a little money for some long-needed furniture. I've been there a little over a year now, but those chairs look like they've been there decades, if not longer. Other than that, I think we're good. And once again, this is some discretionary money that we're awarded because we met some incentive goals last year. So, we have one of these kinds of incentives that happens every year. This year's is actually around oral health.
But back to your note about colorectal screening, and very close to my heart too, way too young family members lost. Public outreach regarding that, or is there a plan for public outreach?
There is a plan.
TV commercials,
We don't know about TV commercials, but one of the good things that's come out of the relationship with Northwell is that Northwell has also set up an early onset cancer center at Phelps. That also means that makes that system available to our residents in regards to ensuring diagnostic confirmation. And one of the biggest concerns we've had is if we're going to sort of initiate any kind of screening in the community, we want to ensure that people have access to ensure that they can get not only through diagnostic confirmation, but treatment and post-survivorship if need be. So, the relationship with Northwell has allowed us now to sort of look at that community provider partner in a very different way. So this is why we're sort of looking at being able to kind of step into this space where I think traditionally local health departments have really just done more around messaging and awareness. Here we would actually be assisting and navigating individuals to actually receive a colorectal kit. We are in discussions currently with Exact Sciences, which owns Cologuard, which just got bought by Abbott Laboratories. But there is interest regionally around this. So this is something programmatically that we are doing with Westchester as well as Dutchess. And, you know, one of my personal goals is that, you know, Putnam be the most screened state, most screened county in the state, I should say.
Yeah.
So we will do whatever we can at the health department to bring that goal to fruition.
And tell us while we're on camera, what age are we recommending now for screening?
So the current screening guidelines are 45 and above. This particular niche program is going to look at individuals between 35 and 45.
Wow. Thank you for that. Thank you, thank you. Any questions from the committee? Any questions from any legislators? Any questions from the public? Okay, I'd like to make a motion to approve budgetary item 26A023 in the amount of $23,084. Can I have a second?
Second.
All in favor?
Aye.
Motion passes. Thank you.
Thank you.
Where's my agenda? Okay, there's a number 7 on the agenda. And number 7 on the agenda is a resolution urging New York State Legislature to pass legislation to increase the personal needs allowance for nursing home residents. The allowance, currently just $50 per month, has not been increased since 1988, and it is intended to cover basic personal items like clothing, toiletries, and other daily needs. Other states have far exceeded this. This resolution is about dignity, ensuring that individuals in long-term care have the ability to meet even the most basic personal needs. We're really lucky here in Putnam County. We have the state ombudsman to quality care for nursing homes right here in Phillipstown. She's also a Phillipstown council person. And now that I'm chair of the health committee, she's literally bombarding me every day with health issues and things on the state level. And I really appreciate that she brought this to my attention. She's very passionate about it, and I'm very, very happy to support this resolution, and I hope you all will too. Any questions from the committee? Any questions from any legislator? Legislator Birmingham?
Yeah, I'd just like to echo a lot of what you're saying. $50 has been around for over almost 40 years, since 1988, and the $50, I mean, the men here who shop for razors today, you can't even buy a box of a month's worth of razors for less than $50. I mean, it's really behind the times, and you know, when this gets out of committee, I'm certainly going to be supporting it on the floor of the full. So thank you and your colleague in Phillipstown for bringing this to our attention.
And I could get a little nudgy here, you know, with the state having knowledge of this and understanding a lot of the calls that I get from folks who have parents in nursing homes and this issue, and how they're left with nothing, how they're left with basically handing everything over to the nursing home companies, and they're left with $50 a month. So, and I know, and I can't wait to hear from Legislator Sage, because I know she's got a personal story about this. So, Legislator Sage?
Yeah, thank you, Chairwoman. I am greatly in favor of this. I recently have been through this. As many of you know, I was just out because my aunt passed away in a nursing home. I was her power of attorney, so I was her only, me and my brother were her only sources of income. She was a retired hairdresser on 100% Medicaid with no house, no children, no husband. And she had to get by on $50 a month. $50 a month. She couldn't buy a pair of pants, a shirt. She couldn't buy hair ties, a brush. She was destitute, she had nothing, and she only had me and my brother to order things for her on Amazon. So it's a shame that our senior citizens have to live like this. She worked her entire life, and her entire Social Security check went to the nursing home with $50 left over. So she literally had nothing. So I can't tell you how near and dear to my heart this is. When it's real to people, it makes it more, I mean, when it's personal, it makes it more, I guess, real. I don't know. I'm just very emotional about it because I've just been through it, and our senior citizens deserve better, especially those who've worked their whole lives, and have nothing.
Thank you.
So.
Any other legislators? Anybody from the public want to make a comment? So the resolution you've all had for a while in your packets, I don't feel the need to read it for the public. It's on the meeting packet website. So with that, I am going to make a motion to pass the resolution for consideration, urging New York State Legislature to pass S 474A and A 8396 to increase the personal needs allowance for nursing home residents. Can I have a second?
Second.
All in favor?
Aye.
Thank you.
Sure.
Yeah, I do, I have an additional, and this is gonna seem confusing, but because of the urgency, the state legislature is in session right now. This is actually, I heard today, in committee, before the health committee. And because of that, my colleague, the ombudsman, is concerned that we'll pass this resolution, hopefully we'll pass it the May full, but in addition, why not? Be noisy. I also drafted a letter that can go to the state legislature tomorrow. I can change and edit the letter to reflect that this is from all of the legislators in Putnam County, if you want to sign on to it. It's basically just the resolution edited into a letter. Oh, sorry, I have to make a motion to accept the additional, my boss told me. Is there a motion I make a motion to accept the additional? Can I have a second?
Second.
All in favor?
Aye.
Thanks, Mary. She's really got my back. So that's it. The letter's been in your box for a bit too, I think. Yeah, we've sent it out a while ago. So I just want to be noisy. Yeah, Legislator Sage.
I would be happy if you would put my name on the bottom and sign with you.
So we'll just, we will edit it to reflect that the Putnam County Legislature, instead of it saying "I" as it says in the letter now, we'll just say the Putnam County Legislature.
If I could,
Sure.
I'd be more than happy to add my support for this. Technically, I don't know if we can speak for the legislature that hasn't approved this. What you might want to do, since you have two additional people who agree with this and are on record as doing that, and I assume your committee is as well, you might want to, being the lawyer here,
Oh, thank
a
you.
majority of the members of the, and I don't want to speak for you guys, if you guys want to sign on too, but you can say at least a
The
majority
following
of the.
members of the legislature.
Yeah, or however you want to do it. I don't need my name on it. I'd be happy to, but or majority of the legislature or the following legislators. If there's only 9 of us or 7 of us that sign on to it, they may think, oh, they're a 20-member legislature and they don't have them.
Yeah.
It's up to you. It's your letter. I think it's completely appropriate as chair for you to send it out. And however
Yeah, we have to word it.
you want to tinker with it, yeah.
About words, but you
But,
all want to
just-
sign on to it. We'll send it out tomorrow in an email for the legislators that aren't here to give them an opportunity.
Yeah.
Okay, thank you.
Can I make a suggestion so that we stay in line with the rules and regulations that we have discussed? Is that we formulate to say that it's up from the committee, along with the support of the legislature. So we're going to be honest about it, right? That the health committee of the Putnam legislature is forwarding this letter in addition to the support. Whether you want to
That's
note
a
that our
great
full
idea.
doesn't come for another month. or
Legal.
not.
Legal.
Oh, there's a lawyer in the house. Legislative counsel.
I mean, the principle is passing, do we want to send a letter? But I mean, for the purposes of nuance of the letter, you could just send an email out and say, you know, who wants to be added, please indicate you want to be added. And if it's everybody, you say everybody, and if it's not, you say the undersigned.
Okay,
Yeah,
yeah,
everyone,
we'll
that's
tweak
fine,
it.
yeah.
Thanks, thank you. So we don't need to move anything. We're not moving anything here. We're just sending the letter out. I just wanted to put it in front of you again to be loud. Okay, with that, is there any other business? That's it, right? All right, then, good. Okay, any other business? And with that, I would like to make a motion to adjourn. Can I have a second?
Second,
All in favor?
aye.
Thank
Good.
you. No, that's it. Tommy and I'll just switch.
Great, thank you so much. Good evening, everyone. Good evening, everyone. Calling to order the Wednesday, April 8th, 2026 Protective Services Committee meeting of the Putnam County Legislature. I ask everybody please rise for the Pledge of Allegiance to start. Montgomery, would you lead us? Thank you so much. Clerk, will you please have the roll call as the next item agenda item?
Legislator Adamizio, Legislator Montgomery.
Here.
Present. Thank you so much. First, the item number 3 on the agenda is the acceptance of minutes. Question here, there are 2 different dates listed. Do we separate those 2, or are we just able to accept them as a group?
We don't need to.
Okay, all right, so we have the acceptance of minutes from October 9th of 2025 and November 12th of 2025. Item number 4 on our agenda is an FYI. It's a fund transfer 26T069 from Probation Department to cover pending shortfall for training and budget. Sorry.
You want me, or?
Hello, yes, thank you. Thanks so much, Commissioner. Just on administrative, sorry, before you start speaking, I should have mentioned that I have asked Legislator Sage to sit in, please, for Legislator Adnuzio, who is not with us tonight, as previously mentioned, unfortunately due to a loss in her family. So welcome and thank you, Legislator Slate, to the Protective Services Committee. Sorry, sir.
That's fine.
You've got the floor.
Thanks for considering this request. I find myself in a position where I have 2 brand-new probation officers who need to be trained. Typically, we send them down to Westchester County. Westchester County Probation Department runs an academy, which is a several-month, 4-month academy. They do it for us for free. This year, they're not running an academy, so I have to send them to other places. And right now, for the first part of their academy there in Albany, I have to find the next 2 components elsewhere. Just their first part is going to cost me just about $8,000. My training budget for the year is $10,000. So I will have exhausted my training budget by the end of May. So I'm requesting to move $20,000 from funds that we had set aside from last year, which were in the contract line. And they came from a pretrial services grant, so this is not taxpayer money that I'm requesting to move. It's from our grant. And I would like to move that into our training line so that I can afford to get our probation officers trained.
Do you, you still, this is 2 of how many openings that we still have?
These are all the openings. I am currently fully staffed.
Great,
and
okay.
so, knock on wood, that will be all for this year.
Excellent, okay. Any questions from the committee?
Just a comment, if I may, through the chair. I'm glad that we're fully staffed. It's good, this is great news. I'm sorry that we're not getting the free training in Westchester. Westchester?
Yeah, Westchester has been really good to us.
Yeah.
They kind of act as a big sister, big brother, whatever, and done a lot for us. But this year, they've had their own budgetary issues. They're not able to hire, and because they can't hire, they obviously don't want to run an academy. So my concern, I have to train my people within a year, so it's not something that I can just postpone until next year, but just in case that was a question of anybody in the legislature, I fear that if we were to do that, if it was even possible, that Westchester will have to hire so many people next year that they won't even have slots to offer us next year. So hopefully, as I said, we'll remain fully staffed and don't have to worry about that until a couple years down the road when Westchester can take over again.
Thank you. Congratulations on being fully staffed.
Thank you.
Must feel good.
Thanks.
Any other questions from any other legislatures? Legislator Russo?
Thank you. I just want to say I'm glad that we're fully staffed and we can move forward. So,
Yes,
thanks.
I appreciate that.
No other questions from legislators? Any questions from the public? All right, Director, this is an FYI, so I don't think we need to take a vote. Thank you so much. Very good.
Thank you. Thanks for coming out.
Thank you.
Thanks, John.
Item number 5 on the agenda is approval of budgetary amendment 26A019, Emergency Services, additional limestone at the Fire Training Center. Item number 5. Anybody here to speak to this issue?
I guess I'll do it. Back to Fall Guy.
It does say FYI.
This is transferring almost $3,000, $2,999 to the Fire Training Center capital project, and they're using operating funds from one of their lines to do it.
Was this brought up in another committee? Because this is, I feel as if the item has been discussed before.
I don't know this one. We did bring a similar one up last year,
Okay.
and it follows the same format.
The same format?
Yep.
Okay. And we do have an approval on this one, but with zero fiscal impact transferring funds between accounts. Any
Correct.
questions from anybody on the committee? Chair recognizes Legislator Slade.
Thank you, Chairman. I'm just curious what they use the limestone for.
That I don't know. That I'd have to ask them.
I don't know either.
Everything.
I think it was gravel that was.
It said on here.
Good question.
Does it say?
You can send a memo,
Does it?
Mr. Chairman.
Sir?
I had the same question. It said about Limestone Garden as well. Even though this will be voted out of, or considered and vote taken out of this committee, it'll also appear before audit at the end of the month. So if the chair is of a mind to do so, he could send a memo to the administration asking
For
for some, yeah,
clarification?
yeah.
Okay, and in the interest of, all right, so thank you Legislator Birmingham. Are there any other questions from any other legislators? No? Any questions from the public? Okay, so in the interest of making progress, I will ask for an approval of Budgetary Amendment 26A019. Do I have a second?
Second.
All in favor?
Aye.
Aye.
Okay, thank you very much. Thank you, Commissioner Carlin. Item number 6 on our agenda is for approval of Budgetary Amendment 26A022, Sheriff's Office, record remaining expenditure and revenue related to the co-response team grant. Item number 6. We have yes, we had the revised version. Okay, thank you. And I see joining us is Under Sheriff Menton. Welcome, in addition to Commissioner Carlin.
Good evening, guys.
Oh, excellent, will do, okay. No problem. I'm making a motion that we accept the revised edition of item number 6 on our agenda.
Second.
All in favor?
Aye.
Thank you. Thank you, Ed. Okay, so we have the revision here in front of us. Gentlemen, educate us.
Well, the grant ends on June 30th, and the sheriff was able to procure an approved grant budget amendment through the state, so we could spend all the funds. Basically, what's gonna happen is we're dedicating the remaining funds basically to purchasing out a vehicle that's being leased and spending down the half-year funds for the person that works in mental health. And hopefully we'll exhaust all the grant funds by the required grant end date, which is June 30th.
Okay, and question, any idea what that amount is that we'd have to try and expend by June 30th?
The car we have there, it's right in, it's about $26,000, I think.
$26,416.
I'm sorry, so these expenditures will bring us to zero then, if we accomplish all of this? But, okay, I'm sorry, I thought there was supplement decisions.
We'll do it, and
Okay,
we'll basically buy out the car that's been leased.
okay, great. Any questions from the committee? Any questions from any of the other legislators on this item? Any questions from the public?
I just have one.
Oh,
Sorry.
okay,
I
let's,
just a note that, is it putting $12,895 back into contingency or pulling that out?
No, we're taking it out.
Taking
because-
additional out
because-
to
yeah,
cover the car.
Well, not the car, it's to cover everything in the grant, because the second half of the year, we have to make sure we cover all the costs that are involved with the CRT team. Remember, the board had indicated that when the grant ended, they wanted the team to continue, so that helps it continue.
Okay, great.
I really want the team to continue,
Yeah.
and I can't wait to talk
Right,
about that at
so
the,
after this year, absent getting another grant sometime in the future, it'll be a taxpayer vote.
I'm looking forward to support whatever is needed to help it continue.
Right.
I had a very healthy meeting through the chair, with social services and the sheriff's team today, and I had a better understanding of this, and thank you.
if Legislator Montgomery's happy, then we're all happy. Okay? I believe there were no other questions. With that being the case, I make a motion for the approval of the revised item number 6.
Second?
All in favor?
Aye.
Thank you. Forwarded, okay. Item number 7 on our agenda is the approval of the Sheriff's Office Intermunicipal Agreement, Police Tactical Team Cooperation. Item number 7.
Yeah, so guys, this IMA is really to assist with mutual aid jobs that we have to participate with Carmel and Kent, their ERT team. We also are going to be able to coordinate with them for training together as one team, so that'll also assist with the mutual aid response.
Okay. Any significant changes from this IMA from prior administrations to the current administration?
No.
Okay. Any other questions
From
the committee?
I have a question.
Chair recognizes Legislator Montgomery.
And because the backup is confidential, I'll be very careful about how I phrase my question. So how do I phrase my question? Keeping it confidential so we don't have to go into executive session. Okay, so, this is an agreement to enter into an agreement with some of the towns in Putnam. So,
Yeah, it's
how
for-
come, so there's some towns but not all? Is that fair?
Well,
Okay.
the towns, Carmel and Kent, have their ERT team as one, right?
Okay,
So we are going to be participating with them with mutual aid jobs, along with training together as one. So when we do all respond together,
we're able to act as one based on our training.
Is there any way to get all of the departments in Putnam to train together?
There are, well, these are specially qualified officers, a part of the ER team and SRT team. So these other departments
Don't have that?
don't have it.
Okay, thank you.
You're welcome.
How'd I do?
Kept it clean, thank goodness. Any other questions from the committee members on item number 7? Okay, any questions from other legislators? The chair recognizes Legislator Goldman.
Thank you, Chairman. Cold Spring as a police department, they're not included in this?
No, none of their members are included in it.
Any other questions from any other legislatures? Any questions from the public? Nobody in the back row wants to throw out a question? Got an opportunity to grill him while he's up here. Okay, with no other questions being observed, I make a motion for approval of item number 7, the Sheriff's Office Intermunicipal Agreement, Police Tactical Team Cooperation. I get a second?
Second.
All in favor?
Aye.
So carried, thank you. Item number 8 on our agenda is an FYI, a fund transfer 26T053 Sheriff's Office. Utilize seized assets funds to upgrade electronic equipment on Special Response Team Equipment Truck. Item number 8. Is this a Mr. Carlin explanation or
No,
on the
I
Sheriff
don't
man?
think so.
Okay.
Yeah, we just need to upgrade some stuff on the truck, some exterior floodlights. We need to update some power banks for charging equipment. We also want to put a reverse camera on the truck.
With the utilization of seized assets.
Correct.
Look at that, it's our favorite, zero fiscal impact.
Yeah.
My favorite one, I found it, okay. Any other questions from the committee members?
Just to be clear, it's zero fiscal impact, not using taxpayer dollars at all. because
Yes.
This is coming from assets that were seized
Seized.
during the operation of the Sheriff's Department.
Just for those who are newer.
Right, that's what I'm,
The seized assets are held by, the sheriff has one and the DA has one. And they are ultimately responsible for determining what are appropriate expenses that those funds can be used for in accordance with the laws and guidelines that they're familiar with. What they have to do is they follow the county budgetary and purchasing policies, but ultimately they decide what the expenses are for in accordance with the applicable laws and guidelines, which I just stated.
The chair recognizes the current legislative counsel.
Yeah, both New York State and the federal government have what's called an asset forfeiture program by which criminals are divested of the proceeds and instrumentalities of their crimes. And that money is then taken and put to use to offset the expense to the taxpayers. So there are guidelines, both federal guidelines for federal funds and state guidelines for state funds. And it is divided according to percentages in the crime. The police get a percentage, OASIS gets a percentage, and the DA's office gets a percentage. The limitations is that the police's money needs to be used for law enforcement purposes, the DA's money needs to be used for DA purposes, and OASIS in New York State does whatever they do with it. But just so you understand how it works.
So I guess the implication would be is if we had more high-value targets here in Putnam, we potentially could have more seized assets, but thankfully we're not.
Thank God we don't.
Thank God we don't, okay. So we were at the legislative, or the other legislative question, the chair recognizes Legislator Goldman.
A question to council. You said Oasis gets part of that?
Yes, the New York State funds by statute, they get part of it.
Only the drug part of it, or everything?
No, just as a matter of course.
Right. Okay, thank you.
Okay, any other questions from the public? All right, and that was an FYI, so we won't have a vote on that, so thank you very much for the explanation. Item number 9 is also an FYI, a fund transfer 26T054, Sheriff's Office Kitchen Supplies.
Yeah, this is for the jail.
You sure you're not cooking anything?
No. You don't want me cooking food there, that's for sure.
Was this discussed previously?
It's always discussed.
I believe it was.
Yeah, I believe it was discussed. So I get is this a new transfer? And Under Sheriff, you might not be able to answer that, but I remember this topic coming up. Is this something that we do a couple of times during the course of the year?
I believe so. I can follow up with that, but I believe that is the case.
Okay. Chair recognizes Legislator Montgomery.
Yeah. Sir, Under Sheriff, this comes up a lot. It comes up in a lot of our departments, in particular, the Office of Senior Resources, and I give the same pitch every time, and I don't know if it's possible. But can we look into, and I'll help, I don't know how to do it, but I'll figure it out. Maybe the regional council can help. How can we get off the plastic? You know, we're spending tens of thousands a year, and I understand this Office of Senior Resources, much like you, needs the utensils pre-wrapped. We had this conversation a long time ago.
Yes, we had.
And the
I
issue
remember it.
this was like even way, like the issue of a proper dishwasher. So just putting it out there again, that's all.
All right.
Down with plastic.
And if I can ask Commissioner Carlin here, because it's subsequent conversations about budget lines and whatnot, is this a normality where everything starts off in miscellaneous supplies, and then during the course of the year, we'll come back and we'll say, this goes to
Yeah,
kitchen?
that does happen. Maybe it's something else, or they may have identified a need. What counts to me is that Jim Greenhouse signed it.
Yeah.
Right.
And that means that it's legitimate and it's for what's needed.
Okay, I was just thinking in terms of the conversation about the account codes,
Captain Greenhouse.
the account codes and so forth, so. Okay, this is also an FYI. Any other questions from any of the legislators? Any questions from the public? So we're all set with that. That was an FYI. And item number 10 on our agenda is a discussion of Sheriff's Office budget organization and object code consolidation. And we will welcome Captain Dominic.
Yeah, we'll have Dominic step up on the podium. He's going to pass out. He's going to pass out some paperwork.
If you don't mind, because here's why. If he's up there, nobody will be able to hear him on the recording because the microphone doesn't pick up the podium.
You got it. So he'll pass around some paper on what we're going to present to you guys.
Second.
All in favor?
Aye.
Aye.
Welcome, Captain. You have the floor. And if you don't mind, who's ever speaking, just point the mic towards who's ever speaking at that time. This way, the audio gets recorded.
Yeah, so I'll hand it off to Dominic to explain what you guys have in front of you. But basically, this is a budget structure modernization pilot program we're trying to get going. It's not about increasing spending, but about improving how we organize, track, and manage resources. Currently, we operate under approximately 29 organization codes, many of which are outdated, redundant, or no longer reflect how we operate today. This creates unnecessary complexity and limits transparency. We are proposing a phased consolidation down to approximately 8 streamlined codes, better aligned with our current operations. In addition, we are looking to consolidating certain object codes, things like office supplies, equipment, and other recurring expenses, to improve purchasing efficiency, reduce duplication, and give us better visibility into spending trends. Through the use of project codes, we will maintain and enhance your ability to track grants, state mandates, and contract-based services. This will be implemented as for year 2027, if approved. If you guys are on board with what we're looking to do for this pilot program, we're looking for your support to move forward with this, and any feedback would be appreciated. I'm going to let Dominic go into the details here on what you guys have in front of you.
Thank you, Undersheriff.
Thank you, Undersheriff. As the Undersheriff said, my name is Dominic Schimento. I'm a captain in administration in the Sheriff's Department. And as he also said, this is really about efficiency and cost savings measures. It still will maintain the transparency that the legislature requires and the public demands. As he also mentioned, we currently work with the Tyler Munis system, as do all county agencies. And at the agency level, we kind of operate in a hierarchical code with organization codes, object codes, and project codes. We do have 29 organizational codes in the sheriff's department now for one agency. Many of those codes were designed for certain programs for COVID. When we had an aviation unit at some point in the past that I've heard about. Just many different codes that they created over the years, and some of them are not used anymore, and some of them are actually populated with zeros during the budget cycle. So what we're looking to do is consolidate a lot of the like features, the features that fall under patrol, the features that fall under the BCI. Kind of think of it as a big wide field, and we're trying to just narrow it down a little bit. The 29 codes, if you take a look at the executive summary, you'll see the 29 codes that are written down there in that box. We want to move down to 8 codes, 1 for the jail and the 7 for the law enforcement side. The reason we want to move this down is that for every organizational code, we have to prepare a 22-page Excel document that spells out how we're going to use the funds. That would not go away, although there wouldn't be 29 Excel documents, there'd be 8 Excel documents. They're still spelled out the same thing, so you'd still get the same information, it's just not across all the different organization codes. Another reason that we're trying to narrow this down is office supplies. Right now, we have multiple different organizations within our own agency ordering pens, right? So we can turn around and have, 7 requisitions for pens and then all the different purchase orders, and we find out that if we would have consolidated this, we could have had 1 order for pens and we wouldn't have had all these extra pens floating around. Same thing with paper, same thing with uniforms, clothing, all these different things that every different organization has an object code for. It just makes everybody do, and not just in our agency, purchasing, finance, everybody's going through all this extra work when it really is not necessary. You can still maintain the exact same amount of transparency by doing this. And under your, the county code, under the Putnam County Code, under the appropriations, you still will see any movement between objects. You still will have that same dollar figure. You still need to come up and do a budget amendment. All of that still exists. So if you turn to page 2 real quick, where it says why consolidation makes sense, I'll give an example that I just recently saw. So at the beginning of each year, everybody orders new law books. Because the laws change, so everybody orders new law books. What I just saw was 6 different organization codes ordering 1, 2, 13 different books at all different times, which required all of those requisitions, which required all of that extra shipping cost. And at the end of the day, if we would have just had it consolidated to 1, we would have had 1 order, 1 ship, 1 requisition, 1 PO. If you go to page 3, the proposed consolidated structure. Everybody's on that page? So if you look over on the left-hand side, there's the 8 parent codes. Those are the largest organizations, say, within the sheriff's department. All of the ones in the middle column, those are the ones that are smaller that fit within actually the larger ones. For example, if you look at patrol, and I know Marine is very important here. So, and I'll explain how you track Marine by doing this in a second. But the bike patrol, the Marine patrol, the aviation, which we don't have, weight enforcement, all of these fall under patrol functions. They're run by patrol members. They're run by deputies that are on the road on an overtime basis. All of this can still be tracked under sheriff patrol. It's not a new thing. The same thing it goes when it talk about the BCI. The narcotics unit falls under the same command structure as the BCI. Same bosses, same reporting structure, same everything. We would maintain, and I'll get into project codes in a second, the things that we have to track specifically for like narcotics, with its grants, whether it's federal funding, whether it's other state funding, all of that gets tracked. And that happens across the board in all these different organization codes. And if I'm going too fast, stop me.
Can you go into detail on patrol as you did go into the same detail under Sheriff BCI? I'm not seeing the sheriff's narcotics lumped in with sheriff domestic violence?
So sheriff's domestic violence was an old program. That was one of the organization codes we had. We don't put anything in it now. I'm just trying to make it as one. It was zeros. There's nothing in there. All of these are all organization codes that I'm trying to put into one so we don't have all these blank ones. Yeah.
Through the chair, and to go to your point and to the captain's point, and Bill would probably be best to answer this, probably the sheriff domestic violence organizational, is that an org code or object
It was an
code?
org code.
Org code was probably put into the sheriff's budget at some point when we received either a federal or state grant. And Bill, we typically do that. Yeah, so the reason it's a lot of zeros now, and it probably has been for quite a few years, is that some of our colleagues over the years have asked for that historical data, even though it might be zero. And I've never understood why they would ask for that. I mean, obviously, except for you and for Tommy and Jake, you know, we're familiar when we get the budget, we have at least 3 columns, a tentative budget, the legislative budget, and the adopted. Of course, 2 of those lines are blank, but we have 2 years going back. I think that's just a function, as the captain is saying, of a legacy holdover of an old grant that we got, that you still have to do 22 of zeros for that?
Yeah, and one thing you
Yeah.
should know is that if something like this were to come again, we could create a project code and track everything with it. It's the way that the whole system is set up. I think that over time and over the years, Munis was used wrong. They used organization codes instead of maybe project codes, which would have been a better function to track things. But it is what it is. You know, it exists, and what we're trying to do is just get rid of the ones that aren't really necessary any longer. Did that answer your question?
Thank you.
Okay. So if you go to the next page where it said object code consolidation, I just gave you an example on office supplies. We talked about that real quick. So every time we want something in the agency, you know, under office supplies, each different individual organization has to put in the requisition in the PO. I believe, and I strongly believe, that if we consolidate this under one person that manages the purchasing, that we don't get 20 boxes of pens, we don't get stuff that we don't need, and we actually save money because we are ordering it because we have money in the budget, instead of saying, do we need it because we have it every place else. And everybody's very parochial in these organization codes on, you know, those are my pens, I use my funds for that, I use this funds for that. It's a little ridiculous, but I mean, it's true. I mean, that's the way it is. By consolidating these, I believe that you're in a much better position to manage and save money. Same thing with the shipping costs. So the next page is the proposed object codes that we'd like to consolidate. Now, these aren't consolidating. You should know that this is not consolidating across the jail in the law enforcement side of the division. They will stay separate always. I don't see at any point that those could ever be combined in any way because of different funding and different federal requirements. So I don't ever see them ever coming together. But across the codes, the law enforcement side, I believe by consolidating these object codes, we do exactly what I was saying. And I'll give you a hypothetical. Chargeback for auto, chargeback for gasoline. I don't believe that anyone is going to say on the agency at the legislator level, you know, which car went to which division in which sheriff's department. We can tell you that. If you have a question, you can ask and we can tell you that. But to be able to break this out across all of the different organizations, you just need to know the cost. You just need to know what the county did for us and what got charged back. If you need a specific car, that's when you call. But if you take a look at those different codes, I have a little bit more there than there should. I looked at it again today, and there's really only 14. Even though there's more than 14 there, I realized some of those were only in one individual organization anyway. So there's no consolidation. It's only one. You see what I'm saying? If you take a look at the next page, just gives you a rough idea of how this project would work, how this would work, and how project codes work. I don't know how much detail I need to go into about project codes, but that's how we track all our grants. That's how we track reimbursement to DSS. That's how we track the Marine Patrol, because everybody's interested in Marine Patrol. We could put a project code on that, so any expenditures that come with the Marine Patrol could be tracked there. Anything that we thought, like the domestic violence, anything the legislatures came up with that said, we really need to track this particular expenditure, we can use a project code. That's what's in Munis. Next page gives you an idea of how we'd want to run this pilot, and the undersheriff said this correctly. This is a pilot, right? If this doesn't work, we'll just go back to the 29 organization codes and just go back to the way it was. I think that's moving backwards, but if it doesn't work, that's the way it is. I think that this pilot will greatly improve efficiency and save money, and I think that once everybody sees it, I think other people might be interested in this. You know, because I don't know if there's other things out there. But if you take a look anyway, 29 codes into 8, consolidate those object codes. And number 3 there, I have had a chance since our last meeting to take a look at this, and we can consolidate the jail. 3 of the codes in the jail are only used to track overtime. So 3 organization codes are only used just to strictly track overtime, where we could make a project code and do the exact same thing. So you'd have an overtime category with, 1, 2, 3, 4, 5, and that would be the federal reimbursement overtime code. So you don't need a whole organization just to track just the overtime. So on the back, the last page here, I just want to say that again, we just looking for support to run this pilot. We want to see if this is gonna work. It's definitely not gonna cost money. It's definitely not gonna erase transparency. But what it's gonna do is probably save everybody a lot of time, both in my office, outside the office, everywhere. So that's pretty much it.
Thank you, Captain, for the explanation right there. I would like to ask a leading question that perhaps you and I have spoken about before was, would there be any negative impact on any other department for us to pilot this with the Sheriff's Department?
Does not affect any other department.
Right? So if we proceed with this pilot, there's no negative effect. And can I ask Commissioner Carlin about that as well, just to verify, Commissioner Carlin? If we go ahead with this pilot program, are there any cascading negative effects to any other department in the county or any other? Would it be problematic for auditors or any other department?
Well, I have to see, I have to look at this. I have to look at it.
Okay.
I'm not sure. It's gonna depend on what the board wants to see. And if you wanna make calls or not make calls or, and what you call transparency. I need to know which orgs are falling, because a lot of the inactive codes, they shouldn't be filing 0 budget report pages. I don't know why we're doing that. To my knowledge, I didn't know we were doing it. That shouldn't happen.
That may be.
When a code is inactive, it's inactive, it falls off the budget report, and it's gone forever.
Well, perhaps that's not the case for those of us who are not in finance, right? So the Sheriff's Department might think that that is an obligation that they have to fulfill. Chair recognizes Legislator Birmingham.
Yeah, that may be our fault. We might have to do some cleanup on the resolution this legislature passes every June for the decentralized budget. That might be a holdover on that, and I have more to say on that, but just to answer that question.
Okay, thank you.
It might be part of that as well, which might need some cleanup, quite frankly.
All right, thank you. I have any questions from the committee?
Not at this time. I appreciate the effort to make it more efficient and transparent. I was trying to pull up the budget to just look at codes, and it's hard enough as it is now, right? So I appreciate any effort to dumb it down.
Thank you.
Sorry.
Make it legislator
Yeah,
ready.
friendly.
That's good. Chair recognizes Legislator Sage.
On its face, it seems like it would be more streamlined, more efficient, save taxpayer dollars. But yeah, it would be interesting to find out more about what you just talked about. Is there an effect on our auditing department? Is there an effect on transparency? I mean, I don't see it here, but, I don't use Munis every day, so I have no idea.
Yeah, this equates to about 6% of our budget. This consolidation, this 6%.
That's a
Any other legislator? Legislator D'Angelo.
I just want to commend you guys for the work you've been doing over the past few months. It's not gone unnoticed, coming in to the department and finding deficiencies and looking how to improve and make things more efficient. I think this is an excellent idea. I certainly hope this committee passes it. I would love to see what this does for you guys.
Thank you. Chair recognizes current legislative counsel.
Through the chair, I think this actually aligns exactly with what John Tully came and presented to the legislature during the budget process, is trying to do this on a county-wide level. And obviously, because the sheriff's department has some independence, different from other departments, I think that this is actually something that probably might have otherwise gone overlooked had they not taken this initiative. So I think this harmonizes with something already being done with virtually every other department. And I think would work nicely and perhaps even coordinate with John Tully so that the orders may even be further consolidated on a county-wide level.
Well, the pilot program does seem to be specific in as much as the sheriff's department and the trial steps that they're attempting to do. So we're all hoping that maybe the pilot program is a guidance for the county going forward. But thank you. Chair recognizes Legislator Goldman.
Thank you, Chairman. If it works well, like you said, it could be a guide for other departments to say, it's doing okay, let's do a similar situation.
Any other legislators? Legislator Birmingham?
Yeah, just a recap of a couple of, just for full disclosure, Chairman Regan and I, of course, met with the captain and the undersheriff and the sheriff last week. They wanted to, brief the chair of the committee on this. And it was very informative meeting, and I thank you for that. What you've given us today is, I think we coined the term legislator-friendly. It gives us some good broad points. But we did talk about a couple. I'm very much enthused by this, by the way, and thank you, to echo my colleagues, thank you for your efforts to thinking about this and presenting it. Very much enthused, but we did talk about transparency last week and how we thought at the time, and perhaps we still do, that there wouldn't need to cause any local law amendments with Article 5 of our code, which requires, if we, all of us, and this is what we get, this is the, and you guys see it too, the fund transfer request that kind of lays down the thresholds as to whether there's a movement between a line under $5,000, obviously, the Commissioner of Finance can sign off on that, or his designee. Between $5,000, $10,000, it's the county exec, along with the legislative consideration, and then up to 10,000 chair of audit, and then 10,000, 25 audit and admin, anything over 25, full legislative approval. We didn't think last week, and by your nodding, it doesn't seem like that will need to be tinkered with under your current
Yeah,
proposal.
so if I failed to mention that, the Putnam County Code in the Chapter 5 under appropriations
Yep.
there, if I didn't mention that, you would still we still would have to do these budgetary amendments
Okay.
for any changes across those consolidated organization codes, or within one object code to another object code that fulfills this guideline.
Right.
This remains.
Right. Under your proposal, though, and again, I'm in favor of this, you're consolidating organization codes. So to the extent where today we have some, I'm going to call it transparency between organization codes with this, would that still exist going from 29 to 8? And if it doesn't, I'm probably okay with that as well, because BCI and narcotics, they're two different organization codes, correct?
They would be one.
They would be one. And I'm fine with that, because I'm a legislator. I'm not going to feel that I am schooled enough or educated enough to tell the sheriff, no, you can't move somebody from BCI to narcotics. I don't know what the need is. That's your job as professionals, as law enforcement professionals. Similar to patrol. I mean, right now we have, Marine Patrol, Bike Patrol, Road Patrol, obviously, all of that as well. I don't know, and Bill's been around longer than I've been, I don't know any legislator who've said to the sheriff, we don't want you to move somebody from Road Patrol to Marine Patrol. And if they did say that, my question to that legislator would be, well, where do you have the expertise to make that call? So I'm in favor of those consolidations of codes.
So if you're asking me this, and maybe I'm not understanding.
Okay.
If you're asking me, once we consolidate those, let's just use the patrol, you're using patrol now.
Yep.
If we consolidate those, unless it has a project code, like we're gonna track.
Yeah.
If it has a project code, this still stays. If it doesn't have a project code and all the overtime's lumped together, no, you're not gonna see now the bike patrol one and the patrol one because it's one now.
I'm only 1 out of 9, but I'm okay with that.
I'm just
Yeah,
explaining.
yeah, okay, no,
I
I
don't know if
appreciate
that's
that.
what you're
It
asking.
is, it is, but I think, and Bill, you remember the days of Jim Gordon as well.
Well, but you picked the wrong one, though. Marine was, everybody wanted to know.
Marine, yeah,
That's
I
why
know.
we got a we'll
Yeah.
get a project
You should have
code.
picked a better example, because Marine, I would probably insist you keep a project code, because there are people who want to know the cost of Oscoban.
So it doesn't have a project code now, and that's what I'm.
No,
that's what
you
I'm
can move
proposing.
it to
Put it to a
that.
project
Yeah.
code, so it's
Right.
always tracked separately.
If you just add Marine Patrol back to the Hudson, we probably wouldn't ask all those questions.
But again, operationally, I don't feel qualified to, we do that holistically at the budget time in our full budget, and we are responsible to taxpayers for the tax levy and the county budget. But I'm sure all my colleagues agree, we rely heavily on your expertise to tell us where the need is, and to the extent we have specific questions, we usually about enforcement or practices or methods, we go into executive session. But to the extent, and I did give you guys our draft, or the decentralized resolution we adopted last June for this budget, and maybe work with the law department or our legislative council to the extent we might need to, if we are in favor of this, to the extent we might need to tinker with that or in any way make amendments to that, if this goes through.
I reviewed that,
Okay.
and I didn't see anywhere where you would make amendments. I had some questions on it that
Okay.
have, like, just countywide implications, but I mean,
Sure.
nothing that had anything
All
to
right.
do with us. Because you asked me to take a look at this.
Yeah, and thank you for that.
And
Yeah,
I took
thank
a
you.
look at
Yeah.
it. But it doesn't, what you require in here doesn't
Okay.
affect what we're doing.
Thank you. Thank you, Mr. Chair.
Any other legislators? Chair recognizes Legislator Sage.
We're discussing the patrol units. We can still ask, I mean, I know there's people who are really concerned about the Marine Patrol. I'm on the bike path a lot, and I've known there's been some violence and things happening on the bike path and homeless people. I'd be interested to see that separately as well, the bike path patrol. I'm on there a lot. I've never seen anybody in the bike path. I've never seen a patrol. I'd be just, is that some information that we could get, or we have to ask that separately, or?
We plan on already coming this spring and summer to have a permanent person assigned to the bike path. So that's going to go without saying.
But would we be able to find out, like,
We
what
track-
resources are being put towards the bike path?
It's going to fall under patrol is what we wanted
That's
to
what
do.
I'm saying.
Yeah.
It wouldn't be,
It wouldn't be a separate project code.
So
We
just
wouldn't think
go
it would
into-
need that.
like, summertime, we're gonna see it's gonna go up, because we've got the Marine Patrol, and we've got the bike path, people are out there, so it's,
But we would be able to tell you what was used for bike patrol, what was used for Marine Patrol, what was used for concerts. Like, we would be able to tell you that.
We can't see that in the budget right now.
You can't, but we'd be able to tell you that.
Right.
We're kind of making things so it's a lot easier. If you have questions, we can give you answers.
okay.
So in that, I'm going to try this one. Through the chair, trying to answer your question right there. I think that what we're talking about here in terms of what you might be thinking of bike patrol is not limited to just an officer on a bike. The sheriff's department may utilize several of tools available to them to provide safety on the bike path. That doesn't always translate to that person who's on a bicycle. So giving them the operational flexibility to use those tools, there's drones, there's patrol, there's other things besides the person on the trail that we would want them to have the operational flexibility, which would, at the end of the day, provide safety for our residents. Might not always translate to a person on a bike.
I know.
Chair recognizes Legislator Russo.
Thank you. I want to say to the sheriff and his entire team who came up with this pilot program, I think it's great. With a finance background, it makes sense, maybe not with Commissioner Carlin. I think this will make sense if we could make sure everything's, broken down properly, but I think what you're trying to do is clean it up, give 8 basic codes and then project codes which most organizations use, and then that's where your detail is.
Right, where you need to track the detail, yes,
Right.
absolutely.
So I think it would be an overall basic budget lines with project details where if we did ask, we could get those details. I don't think it's gonna break down to less than a patrolman in a different district, whether it's the bike path or in a car somewhere else. It's
that
all
doesn't change.
patrol,
That-
correct.
that- None of our operational, nothing changes operationally. Nothing changes. What this does, it just makes a lot less work for everybody and streamlines this. It's gonna help you when you have to look at the budget, and there's not gonna be 600 pages, because we just took out 200.
Right.
Are there any other legislators who haven't asked or spoken on this yet? Okay, anybody from the public? Commissioner Carlin, you're standing up there?
Yeah, no, I just don't want to give off my happy demeanor saying I don't want to do this. That's not
Okay.
it at all.
What I heard from you is
What I'm saying
TBD.
is I agree with Dominic that you can probably consolidate org codes and take a greater advantage of project codes, absolutely.
Okay.
What you don't want to do, though, is eliminate project codes and then everything goes into just one pot.
Right.
That's what you have to be careful, so you'd have to see is, and the other thing is this has to be done in the budget process. There's no way you're gonna be able to modify the current year budgets and journalize all expenses all over the place. And that's why they're here now. You wanna do this with the 27 budget. And just know, when you do it, of course, you'll lose the past history. So if somebody says, you spent 5,000 on cell phones last year, why is it this number? You're gonna have a lot of those questions. You're not gonna be able to go from year to year, just for the first year.
But don't those organization codes still remain?
They do, but they won't be they might be up here in an org and down here in a project code.
Right, but we still should get the history, right? We still should-
Right, but they won't be able to just go line by line.
Right.
Straight.
And
24
straight line
right,
across.
right.
Right, yeah, you won't be able to do that.
Okay. So making note that this is a discussion.
Yeah, you'll have the 1-year growing pain.
So making note that this is a discussion, and again, thank you, gentlemen, for the presentation. So we're not going to vote on anything here tonight, so the last question be, what happens next? Assuming it does seem like there's a favorable, generally a favorable feeling to the room, what's
I would like
next?
to meet with finance and audit and just talk this out more, just to make sure that, I'm not mistaken here.
Okay,
No, and Dominic's absolutely right. You want to put something together in the 27 budget and not have somebody say, put it back.
Right.
That would be a disaster.
okay, all right. Thank you very much. Thank you, gentlemen. Great
Thank
discussion.
you.
That was item number 10 on the agenda of Protective Services. Item number 11 is an FYI, the coroner's first quarter case statistics. I don't believe that's confidential, right? But do we read that out?
It's not confidential.
It's not confidential, but the numerics that I'm seeing do not look vastly different than last year's. At least I don't think so. This is an FYI. Any thoughts or questions from committee members here, looking at this?
Nope.
I'm looking at last year's numbers. Sorry, through the chair.
Yes, no, please.
And they're spot on, but we have one less suicide
In the quarter,
in the quarter.
in the quarter.
So I'm hopeful that, there'll be less and less.
Total.
Down
Okay.
to 0.
Any other questions from other legislators about the coroner's first quarter report? Any questions from the public on that? Okay, that's an FYI. Any items for other business in relation to current agenda items? Seeing that there's none, I'll move on to agenda item 13, make a motion for adjournment.
Second.
Second, all in favor?
Aye.
Aye, thank you so much.
Okay. Good evening and welcome to the April 8th special meeting of the County Legislature. I would ask everybody to please stand for the pledge, and I'd ask Legislator Russo to lead us, please.
I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. If I could ask you to please remain standing, I'd turn to Legislator Regan to give us our legislative prayer.
Thank you, Chairman. We seek blessings on the tasks before us here this evening. Please bless our efforts with clear insight, our deliberations with wisdom, our work with clarity and accuracy, and our decisions with impartiality. Amen.
Amen. Thank you. I'd ask the clerk to call the roll, please.
District 1, Legislator Montgomery. District 2, Legislator Goulman.
Present.
District 3, Legislator Adenizio. District 4, Legislator Russo.
Present.
District 5, Legislator D'Angelo.
Present.
District 6, Legislator Regan.
Present.
District 8, Legislator Sage.
Present.
District 9, Legislator Crowley. And District 7, Chairman Birmingham.
Here, thank you. Again, welcome to the special meeting. This is a one-item agenda. It's it's a local law providing for a counsel to the county legislature. It is a charter change. One of its provisions is a charter change, so there will be needed tonight 6 votes to pass this. And, I'm just gonna review, we've talked about this for quite a few meetings, dating back to last year. It's popped up in very different versions. And certainly we're going to open up to the floor for all legislators to speak. But if I could, I'd just like to take a first shot at it. This is a resolution that came out of the Rules Committee meeting back in March and came out amended. It was amended with 4 amendments, the most salient of which are 2 of which came from, actually 3 of which came from Legislator Montgomery. And the first one is with respect to, and this is what makes it a charter change, Section 6 of the local law. It's adding a new unenumerated paragraph in Section 8.05 of the county charter that it says, in the event of a direct conflict between the county legislature and the county executive and any legal action or proceeding, the legislature may retain independent legal counsel by resolution. From my perspective, that, I think, might help clarify some of what I view as ambiguity between certain portions of the existing charter and the county code with respect to hiring of outside counsel by this legislature, and this just, makes it by resolution. That's one of the amendments that were made to the original resolution. The other one is that the request for legislative drafting or advisory services from the Legislative Council shall remain confidential to the requesting legislator unless otherwise authorized by such requesting legislator. And then another one was council shall be available to provide advisory services to all members of the legislature. And again, that was, I think, just to clarify what was already present, but it makes it now one of the scope of the duties of the county counsel to the legislature is that no matter what party you're in, every legislator should have equal access and equal confidential access to the counsel to the legislature. And then there was another amendment, which was the selection process. That was, I think, by either Legislator Sage or Legislator Adenizio. Okay, my mistake. Where the process would include an executive session interview for legislative counsel, which would take place not only among the all legislators, but also the legislative clerk and I believe somebody from the personnel department. So on top of that, that's really the changes that came out of last month's meeting. But again, I am going to be quiet in a moment because I know there's a lot has to be said on this, but I think it's critically important that this county legislature has a legislative council that is independent of any administrative department. I believe I know we've always had that. Historically, that legislative council has been, up until about 8 or 9 years ago, an employee of the county through this legislative office. It was only in recent times, over the last 7 or 8 years, that it was a contractual relationship, which I think was some of the reasons why some of us are looking for some more clarity on this. we're equal branches of government. The county legislature and the county executive are co-equal, and, I just think it's important that we have our own council. Again, I'm going to sound like a broken record to Heather and her predecessor, Conrad. We have been served well, more than well, by both of you over the last year and change. And this certainly is no reflection on your advice or your counsel. And I know you know that. So it's just more of a structural independence thing. It's going to go, if it passes, beyond all of our tenures here. So that's really what the aim is for this. So I'm going to be quiet now, just open it up to my colleagues. If anybody'd like to speak about the matter. Legislator D'Angelo.
Yeah, thank you. When I proposed this bill, I was frankly excited at the prospect of taking a vote on it at the full, because I found it to be a compromise. I actually know it to be a compromise because, like I said last evening, it was word for word Legislator Birmingham's proposal, just minus a stipulation that gave the single minority Democrat a veto, essentially, as it pertained to the hiring process. I removed that. I thought what I gave was just a clean, straightforward bill. It was independent counsel. And then once more, Legislator Birmingham capitulated to the Democrat, and now we've kind of blown up this bill. We keep talking about a conflict between the executive branch and a conflict between the executive branch and the legislature, but we just created a conflict in the charter, because when we have a conflict with the executive branch, we already have access to the county attorney. That's our representation. So now this creates a conflict in the charter with no solution to it. Honestly, I think that this has been discussed ad nauseum at this point. I don't know what else there is to discuss. I ask that we call the question and just take the vote.
That would be an appropriate motion if every legislator had spoken, but according to our rules, a motion to call the question can only be entertained after all legislators have spoken. So I wouldn't want to cut any, and I'm sure you wouldn't want to either. I wouldn't want to cut off any of my colleagues. And maybe there is no one else who wants to speak, but I do want to give them the chance. Any other legislator care to speak on this matter? Legislator Sage.
Yes. So, looking around this room, there were only 3 legislators on this legislature that were here when all of this happened. And it was an explosion, including our staff. This legislature must have its own independent counsel to the legislature, period. We cannot do our job, protect this institution, or provide real oversight if our legal advice and representation are dependent on the county executive or the executive branch or a department head selected by the county executive. The legislature selected counsel is not a luxury. It's a basic requirement of an independent legislative branch. Let's be clear, this is not novel, radical, or even optional. This is how this legislature has always operated. Is how a separate branch of government protects its authority. For years, the legislature has retained its own counsel, separate from the executive branch, selected by a legislative vote to represent the legislature's interests. No one else's, a branch of government. The most recent RFP, which I have right here, was issued in 2021. This is a 34-page RFP that was issued in 2021. Counsel was selected and approved for a term running January 2022 through December 2024, with 3 one-year renewals. This legislature voted on that and approved it. On December 3rd, 2024, we voted to exercise the first one-year renewal. It was passed at that meeting. We also voted to amend the charter. At that same meeting, coincidentally, we amended the county attorney's charter with respect to the county attorney, that same meeting. Funny how that happened. Then the legislature's decision that was voted on at that meeting was effectively nullified. After we voted to retain legislative counsel, according to this RFP that was voted for with a body of 9 in the legislature, after we voted to retain counsel, the county attorney found a loophole in the charter
Point of order.
and used it to
She's
eliminate.
talking about an RFP where this is not.
Excuse me, I have the floor here.
No crosstalk, please. Is there a point of procedural order or, that you have?
I don't see how this relates to the agenda item.
That-
Well, maybe you should listen.
That's
Please,
the problem.
I've
I'm
got the
listening.
floor. I've got
That's
the floor
the
right now,
issue.
folks.
I'm listening. What you're
Each
saying doesn't make
legislator-
sense. We should just call the question. This is ridiculous.
Sir, please. Each legislator has the right to frame their argument in the way they see fit. The chair has the right to rule things as non-germane. I haven't heard anything that is not germane to this discussion. I haven't heard anything that would be unrelated to this topic. Please continue.
I'm sorry you don't want to hear this, but
Please, no
you will.
crosstalk, no crosstalk.
Then the legislature's decision was effectively nullified by this vote. After we voted to retain legislative counsel, the county attorney found a loophole in the charter and used it to eliminate our counsel that this body had approved, despite our vote without legislative consent. We were hit then with a lawsuit from the county executive, and we were told to accept counsel assigned to us by the county attorney's office. I would imagine that's the reason for adding the additional amendment that Legislator Montgomery discussed. There was a definite conflict with the lawsuit, and we needed to retain our own counsel, chosen by the legislature, which we did. However, the county attorney to this date has refused to pay the counsel that we hired to represent us, while the county executive spent $50,000 to sue the legislature only to drop it the night before. Even more alarming, our current legislative counsel was also representing the county in a court litigation connected with the elimination of our previous legislative counsel. That is not independent representation. That is the executive branch controlling the legislature and flipping the table of checks and balances and creating a weaker legislature with the built-in conflict of interest.
Can I ask you to pause? Is there a point of order or some?
Yeah, I mean, through the chair, I mean, that's just inaccurate. I did not represent the legislature.
No, I
at
said the
time that I
county.
did that.
You represented the county.
Yeah, I did my job, but how is there anything?
I'm just pointing out, I'm making a point.
I don't think she even knows what she's saying, honestly.
The words that you use, and I was not your current legislative
No,
counsel, and I was not. in
now
your
you're
role
current.
the
At the time, you were not.
I understand.
I think maybe she's confused. I don't know. Chance.
If we could stay on topic, if we could.
Yeah. We are elected to legislate, to oversee, to serve as checks and balances, not to operate at the pleasure of the executive branch. Independent counsel chosen by this legislature is essential to that duty. If we surrender control of our legal advice and representation, we surrender the independence of this institution. Right now, we are being represented by the same department that eliminated the counsel this legislature voted to retain. Again, I'm going to state over and over again, I am very pleased with who we have representing us at this time. But it's not a position that is paid for and voted on and selected by the legislature. I would love to retain our current legislative counsel as only legislative counsel, but not dual roles. That is a direct conflict of interest, and we should not accept it, ever. This is bigger than any one disagreement. It's bigger than a lawsuit. It's bigger than anything else. It is about whether the legislature remains an independent branch of government. The fix is simple. The vote is in our hands. Reestablish independent counsel to the legislature and ensure that counsel answers to the legislature alone. I'm asking you to vote yes on this today so we can put this behind us, we can restore independence, we can end the dysfunction, and get back to people's work. Thank you.
Thank you. Any legislator who hasn't spoken yet?
I will speak.
Legislator Montgomery?
Sure. I'm just remembering statements made yesterday in reviewing the original proposal from Legislator D'Angelo. A statement was made that it created independent counsel, but in reviewing Legislator D'Angelo's proposal, there was no clear affirmative statement that the proposed legislative counsel would be independent of the county attorney or independent of the county executive. And I think that absence matters more than it just sounds in his proposal.
So where was that amendment?
Sir, no crosstalk, please.
What the proposal did do, it created a legislative role. It placed that role with the county structure without clearly removing it from the Department of Law. And it did not explicitly define independence, scope limitations, or separation of powers. The amendments did that. So that the original proposal, those are the problems, because in county government, independence is not implied just because, as we see the way we operate here, it's never implied. It must be stated in a local law. So if the local law does not explicitly place counsel outside the Department of Law and does not explicitly limit the county attorney's authority over it, then by default, courts and practitioners will generally interpret the position is subordinate or controlled by the county attorney, and therefore indirectly influenced by the county executive, who appoints the county attorney. So what is missing from Legislator D'Angelo's version was the language shall not be subject to the supervision, direction, or control of the county attorney. That's what was missing. Shall serve solely at the pleasure of the legislature, or majority minority caucus, we could say, and is established outside of Article 8, the Department of Law, and that's what's needed. So, so my amendments and what I've been trying to preserve is exactly what closes those gaps in the Legislator D'Angelo's proposal. It gives structural independence, not housed under the county attorney. It gives functional independence, and it means that attorney that we appoint can advise legislators without interference, which is what I've personally experienced on this legislature. And it provides access for all legislators, and there's no conflict of authority when the legislature is in conflict with the county executive. So without those, we risk becoming, or the new county attorney, the legislative attorney risks becoming the de facto extension of the county attorney's office, rather than a true legislative council. So the original proposal created a council position, but it never actually established independence from the county attorney or the executive. And without that, it doesn't change or balance power at all. So I proposed 3 amendments to do that, and I hope you will support it tonight.
Thank you. We have Bill, Tommy, and Laura have not yet spoken on this matter. Would any of the 3 of you care to weigh in? Legislator Russo.
Thank you. Back when we had the budget process, I did agree that I approved money in the budget for outside legal counsel. But my point and my oath that I've taken for the residents of Putnam County, including my town Patterson, is to properly spend taxpayer dollars. And I feel, as everybody on this legislature has said many times, our legal counsel provided by Putnam County residents' tax-paying dollars has been superb. Anytime anybody's reached out, I haven't heard that our legal counsel has not provided proper legal advice. When at some point in here, all these resolutions, the county legislature will be, or it's proposed to have legal outside counsel. But what about the county executive? We are supposed to have legal counsel from our county law. What happens to the county executive in this new legal law? He doesn't have any legal counsel.
Or is that a question you're asking? Because I have a...
Well, I'd like it to be clarified.
Well, it's already spelled out quite clearly in Section 8.05 of the Charter. In the event of a conflict between the executive and the legislative branch, you're right, the county legislature, county attorney represents the county legislature. The following sentence right after that says that in such event, you won't find it in here, it's already in 805.
Oh, all right.
Yeah, and it's been in there for about 20 years. The following sentence says, in such event, the county executive shall be provided with county-paid outside counsel. So and this doesn't change that. I'm not going to, this is your time, not mine, but to answer your direct question, it's already provided for in the charter. And please continue.
No, that's fine. So, again, I've advocated, since I've been on the legislature, I wasn't here when we had outside counsel, but I feel well represented by our current legal counsel.
Thank you. Bill or Tommy?
Go ahead. Thank you, Chairman.
Legislator Regan.
Thank you so much. I would like to, through the chair, perhaps look to assuage or perhaps influence my colleague, Legislator D'Angelo here, in as much as I think you and I share a lot of similar feelings on our frustration with this long, drawn-out process. And what perhaps might make you cringe is what I call the Jancy proposal, right? A combination of Jake and Nancy's proposal that we're voting on here tonight. Sorry to both of you. But nonetheless, Jake, I call upon us to do what you and I have spoken about, which is to put this issue to bed with a positive vote. A negative vote will prolong this discussion. This is not exactly the proposal that perhaps you wanted, or even myself, but you okay? You sure? Okay. I just want to make sure you're not choking over there. So perhaps it's not ideal, and perhaps it's not everything that you and I would like, but I do look for you to support this initiative tonight so we can move on from this discussion of this topic and get to the business of the people like we had discussed previously.
May I answer?
Sure.
Yeah, well, it's.
And then we're going to go to Bill.
Sure, absolutely. It's not that it's not ideal. There's question marks as to what happens next. As you just mentioned, the county executive has a county-funded counsel that he can then retain. So we have the county attorney, legislative counsel, and now the county executive can spend money and get counsel for himself. We're just spending, there's no answer. This is an incomplete bill. The charter change and the ramifications of it made this incomplete. I don't like to vote on things that don't have answers. It's not that I don't support this in practice, it's that this is just short-sighted. There's no answer to that particular question, and it's tax dollars on lawyers. We need answers to that, and there is none here, so.
Still your time.
Okay,
Yeah.
we go back. I don't think that at its origin and in its current form, we were ever seeking to resolve or change the situation of legal counsel pertaining to the county executive. And I believe that's gotten looped into the conversation.
Because if you're going to alter that, it
Well,
has those effects. You have to know that.
I don't think that's a function of this proposal, all right? Is that not a separate issue altogether?
I mean, yes and no, but in practice, you're now going to have the county attorney and legislative counsel both representing the legislature, and now it becomes an expenditure for the county executive to retain his own, like that. I'm just saying there's a clear solution there that's not being spelled out, and so I find that to be wasteful. Yes, at face value, if you don't add context, which it seems like much of this legislature likes to leave a lot of context out to help fit their narratives that they're pushing, you leave the context out, yeah, sure, maybe that's not directly in conflict with each other, but it really is. In practice, it is, and that's why I can't support it.
Still your time if you'd like to cede. I mean, I'm going to give everybody as much time as, but I want every legislator to have the opportunity to speak before we go to anybody else.
Never at a loss for words, but I am at this point.
Okay.
Thank you.
I saw Legislator Goldman hasn't spoken yet, and then I saw Legislator
Thank you, Chairman.
Sage's hand up, and then Legislator Montgomery. And then we'll do another round for anyone else who wants to.
Thank you.
Go ahead, Bill.
A few months ago, I put together a proposal, which I thought was an ideal proposal. And our counsel at the time said, if that goes through, it's going to be a charter change. She suggested a charter change commission at that time. So I dropped my proposal, withdrew my proposal, and requested that this body bring up a charter change commission to review this and other laws that we have on the books. Well, it never made it out of committee. We have discussed this for many months, as been mentioned by Legislator Sage and other people. And 2 months ago, we agreed to a proposal that Legislator D'Angelo brought forward. This proposal wasn't everything I wanted, but we all agreed to it.
We did.
It did not cause a charter change at that time. That item came out of committee, that proposal. Now, we've had some hard negotiation in the last few months, and at the last minute, we have some things that have been sneaked in to make it a charter change. I agree totally that we need to be an independent branch of government, and we need an independent legislative council. I supported that originally. With these changes, I don't. I'm very conflicted with this because I want a independent council and make us an independent branch of government. But I can't do it without having it in a charter change. Our council at the time suggested that to do this, we need a charter change commission. So basically, I'm going to abstain from this vote because we either go for a charter change commission, which no one seems to want. Why? I'm not really sure. It takes it out of our hands and gives it someone else, and they will help us make that decision, or go back to the original proposal that we all put together, which 2 months ago, without any amendments. So I'll be abstaining for that reason.
Bill, could I, before I get to legislators Sage and Montgomery, could I
Of
perhaps
course.
give you something that might help you with that decision? Because, and I've wanted to speak about this publicly for a while because it has been bandied about. We did get a resolution and a recommendation from our county executive to hold a charter review commission, which we typically do every 10 years. But I think there's been some fundamental misunderstanding about Section 1506 of the county charter, which speaks to our charter review commission. I'm going to read it for us all, but it's my reading, and I think it'll be apparent to everyone else that we cannot have a charter review commission except for every 10 years. So if that's, Bill, I'm going to read it. So I just want to set the table, and hopefully that'll alleviate what appears to be the only reason you have for voting against this. And let me read it. It says, the county legislature shall appoint a charter review commission to review the Putnam County Charter and make recommendations for revisions thereof at an interval of not less than 10 years, starting in the year 2000. So that phrase is very important. Our charter, the way it exists now, says we can appoint, we don't have to, or actually we do have to. Every 10 years we have to appoint a charter review commission. However, that appointment of a charter review commission, and this is right out of the charter, can occur in intervals of not less than 10 years. The last time we had a charter review commission, I believe, was in 2021. And we're in a period now where this same phrase goes on. However, nothing contained herein shall prevent the amendment of the charter at any time. So this is what we're doing here. We're amending the charter individually, and we have done it we do it quite often, actually. And I've proposed and have had passed charter amendments, specific ones, but 1506 indicates, and our counsel has her hand up, so I hope she's not going to contradict me, but my reading of this is that we shall have a charter review commission, but at not an interval less than 10 years.
You just said we could, but then you said we can't.
No, it says
Counsel
a commission shall be appointed at intervals of not less than 10 years.
Should the legislature have an appetite for a charter review commission at an interval different than what is set in the charter, nothing prevents you from amending the charter in order to effect that change.
And I'd be happy to talk about that, but we don't have that charter amendment before us, and we never have. Yeah, I know, you're not commenting on policy, but we.
The same way that you could amend the charter
Right.
to piecemeal, patchwork together different changes at all different times, you could similarly amend the charter to allow for it because there seems to be an appetite and need for various sections of the charter to be fixed for a whole host of reasons at different points every legislator has pointed out, and it's been well taken. And you would be able to have a harmonized document that works all together without changing one piece and realizing messed up something else that wasn't changed.
Right.
And so I think that the idea and purpose behind it is to make sure that, points that, Legislator Montgomery has addressed, are addressed holistically, that you don't miss something that should have been changed. Points that, Legislator Goulman has addressed are changed, so that there are other things that we've all discussed that we've, as we've gone on, well, that's still in there, how is this, there's been talks about language that's been used and whether that language is still appropriate. This is something that, should the legislature have an appetite to do, it is within your power to do.
But we don't have a charter review motion before us in the form of a charter change. What we're
Correct.
dealing with now, and that in and of itself would be a piecemeal charter change as well. So, we have before us, Bill, there's nothing to
If we go
prevent
back
you.
to the original proposal, I'll vote for it, but I'm not gonna vote for it this way. I'm not gonna vote against it, I'm gonna abstain. Because I'm very conflicted with this. I want an independent, council. I want us to be independent, but in this, adding a bunch of amendments to it at the last minute, I don't like, so
Yeah, go
I'm
on.
gonna abstain. Thank you.
Everyone's been recognized. Could I call the question, make a motion to
No,
call the
because
question?
my comments were introductory as the mover. I haven't spoken on the substance of the chart, of the
Okay,
resolution yet.
right.
Legislator Sage and Legislator Montgomery.
So I'm looking at the previous RFP that we had proposed in 2021. The actual scope and role of the position of the council to the legislature has not changed in anything, especially not in our proposal here. The breadth and the scope is just exactly the same, according to the RFP. So the position hasn't changed, the requirements haven't changed. And previously with our previous legislative council, we always spoke individually and asked, as a chair of a committee, we asked, can you please write a proposal for me regarding ABC? And then he would come back and write a proposal for you for ABC. That was one of the amendments, that everyone has access and confidentiality, which we've always had. Another one of the amendments was the way we vote, and that's exactly the way we did it before, is we all go into a room and we vote. So there's two things that haven't changed. The independence and limitations hasn't changed. Conflicts hasn't changed. The only thing that was added was that one little section that talked about the ability for the legislature, if they were involved in some type of discrepancy or some type of a lawsuit, to be able to choose their own counsel without being assigned counsel from the county attorney. When we tried to do that before, and we did, the RFP, it wasn't paid for because they said you're not allowed to hire your own. There was a Duffy case that said you are allowed to hire your own attorney, so it did go through a court of law. There's nothing new in this, and this is all things that allow our legislature to be a separate branch of government. I would like, and we've always paid, as far as the money is concerned, we have a line item, we've always had a line item, we've always paid a county attorney. We have it in the budget now. We've always paid our legislative counsel. We need separate legislative counsel. We don't want someone who's being paid by another department to represent our department. And as I said before, I would be happy if our current legislative counsel came to the legislative side. Just come on over. We'll be happy to have you as an independent counsel because you've done a great job. But you have a dual role, and you have a role in another department, which does not serve the legislature, and that's not separate, an equal branch of government. So I don't see what the sticking point is here, because if we have legislative counsel, I don't know why you wouldn't want it. I just don't know. There's no change here. We have it in the budget. and it just strengthens county government. I don't know why you wouldn't want to do that.
No one said they didn't want it, for the
Please
record.
wait to be recognized by the chair. Next legislator to speak is Legislator Montgomery.
So, first of all, I apologize, but I might have to disagree on the language of 1506 and the Charter Review Commission. And council's gonna laugh at me, probably, because I read it differently, and I read law differently. I mean, sometimes than most. And when I read the charter, I read every 10 years as a minimum requirement, not a maximum. And we must do a review every 10 years. It cannot go longer than 10 years without review. But it does not say only. That charter does not say only every 10 years. It says not. But that's beside the point. I have no interest in doing a charter review commission. We did it in 2021. We're required to do it every 10 years. I'm a legislator. You're all legislators. I've been legislating for 20 years. I don't want that role taken away from me. I am not afraid to propose a law. I'm a legislator. That's what legislators do. We propose laws. The way I see the holdup possibly for this resolution, the way it's before us, is that one clause about the county executive retaining independent counsel, and that it would be costly to the taxpayer. There's nothing to prevent us from changing that simple language to state the county executive will be represented by the county attorney. The legislature is represented by independent counsel. And I don't understand why there is pushback about having independent counsel. The original resolution does not create independent counsel. Our role as legislators is to function as a co-equal branch of government. That is my responsibility to my constituents. That's who I work for. I don't know who the people you work for who are pushing back on this. I work for the people of this county. And I don't know why you're pushing back on independent counsel. The original resolution does not create independent counsel. The local law before us reflects that principle of independent counsel. It establishes counsel that is independent of the executive branch. It's advisory, and it's available to all members of this body.
Thank you. Any other legislator care to speak before I speak? I know. We're probably going to get to that afterwards. Thank you. Is that something on a point of order or a legal matter or a policy matter? If you could just identify, we come to you for legal advice. Are you about to give us legal advice?
I wanted to speak on what the role of an attorney is and the independence of the role of an attorney and who I answer to.
She's making some
I think it's a good idea.
some pretty excessive accusations. I mean,
Well, please, no crosstalk.
I know.
I think that's fair. You were addressed directly, and to the extent you have something to add. But please identify it as either legal advice
It's a legal statement of
and
generally.
not, is it a policy statement or a legal
It
statement?
is a legal statement.
Go right ahead. And it's to help us with this.
To help you understand the independence of attorneys. Generally,
Okay.
okay?
It's a little off point from what we're discussing, from what the resolution is, but it has been discussed tonight. It has been discussed tonight, so,
Decisions that need to be made with respect to it.
okay.
Okay, attorneys take an oath of office.
Indeed.
We have to go and we have to sign before, and we have to be examined before a character and fitness board to go into our background. We have to fill out a whole form, and they have to decide that we are fit and ethical enough to be an attorney. And then we have to take an oath, and we have to say that we are going to follow the code of professional conduct as attorneys. And that code of professional conduct tells us how we deal with conflict of interest. How, if we are in a role, like dual roles, when we have to recuse ourselves, which I did when I became legislative counsel. As, you know, Legislator Birmingham recuses herself. We are trained, and we have to take a whole separate exam. In addition to the bar exam, we have to take an exam about ethics and to know how to navigate these roles. So understand that it is, you know, and I know no one means it this way because you didn't know this, but the thing is that it's very hurtful and offensive to attorneys to be told that we are not independent, or that we would not guide you with independence, or that we are doing something in any sort of way that we are conflict-ridden, because I promise you, I take my ethical responsibilities very seriously. And if I ever was put in a position in this role that I felt I had a conflict, I would recuse myself. And not only would I recuse myself, and so from that, if I felt like just in general that my job was conflict-laden, I wouldn't take the job. Everyone here knows how much I make, and I lose money every single hour that I stay here. I'm here in service to Putnam County, in service to all of you. Just understand that.
Those are very appropriate points to make.
Absolutely.
And I thank you for making them. And I think I can speak for all of us. I certainly speak for myself that your service, as I said at the beginning, and your predecessor, Conrad, has been nothing but stellar and exemplary. And I take that to heart, and I think all my colleagues do as well. So thank you for that, and thank you for reminding us of that, because sometimes perhaps we do have to be reminded of that. So thank you.
I think this protects that very thing.
Okay.
That's what this protects. Any feeling of, which I've experienced, and you can all attest to it. Not with this legislative attorney, and that's what we're trying to protect here.
I know you, not as well as I know Compton, the county attorney, but I can say that having known him for many years, decades, I'm very confident with his service to this county. I'm very confident with his appointment of his deputy county attorneys, of course, including yourself. My point is that this is, like I said at the beginning, it is an effort to have something institutionally in our charter that will survive all of our terms. We have 2 new legislators who might be here for the next 11 years. But that's in the blink of an eye in Putnam County's history. So my efforts in all of this, and I'd like to think, and I do think, all of my colleagues' efforts on both sides of the issue, is one that we want to make sure that the strongest county government we can have is a county government that has co-equal branches. I'm a little bit of a history buff. I've read, as I'm sure a lot of us had, or at least studied in school anyway, the Federalist Papers, which sets up our federal system of government, which of course has 3 co-equal branches. And the reason for those co-equal branches is so that we can have a stronger freedom among not only the branches themselves, but among the people we represent. The best government we can have is a government that has, in this case, both branches equally armed with respect to legal advice, independent legal advice. And again, I think we've been very well served. This is not a comment along those lines. But to have an independent county legislature that I remember as a legislator 20 years ago when I was last on this legislature, we appoint, and again, I think the foot fault came up here is when we made it a contract. I think that happened in 2016. Before that, it was a county legislative employee. And, you know, at that point, there was no question. We got to it just like we appoint our auditor, who works for the county legislature, for the county, but you're in our branch of government, our county clerk, our legislative clerk, as well as, at the time, our county legislative counsel. But for whatever reason that happened, again, I wasn't here. Were you here with Clem or no?
Just the year after.
Okay, Clem Van
I
Ross
ran
was
for
our
it.
last, yeah, okay. Clem Van Ross was our last legislative counsel who was an employee of this legislature. So my point in all of this is that I think this is a good way, and I don't think the proposal that Jake put forward, other than those 4 amendments, and I think 3 of them, I don't think anybody have an issue with. I mean, again, to get back to and then I'll shut up and we'll call the question, but if we could just review the differences between, and we joked about it before the meeting started, the D'Angelo resolution, or what did you call it? The Jancy proposal.
It's your resolution.
Well,
Your resolution.
well, then the only changes to that, other than the legislative minority majority part, which is significant, you would agree, are these following points, other than that one. Number 9, the council shall be available to provide advisory services to all members of the legislature. I don't think anybody disagree with that. That's, okay, that's one change. The item number 10 is requests for legislative drafting or advisory services shall remain confidential to the requesting legislator unless otherwise authorized by the requesting legislator. I don't think any legislator would have a problem with that either. And I don't want to speak for anybody, but I don't think that'd be a problem. The other difference between whatever proposal we're going to call it, there's two more. I'm getting to the significant one at the end, but the other one is the selection process. And merely that just changed that resolution from being one where it would be, didn't spell out the selection process to one that would be where the legislature would conduct interviews in executive session, which I understand is the way it happened in the past. But we would also invite the legislative clerk as well as somebody from the personnel department there as well. And to Jake's point, though, I think this is where the hangup comes up. And I don't think, what's that movie, Princess Bride? I don't think that term means what you think it means. That's a movie where this is the charter change, and this is what makes it needing 6 votes.
It's inconceivable.
That comes out of that movie as well. This is the only change that makes this a charter change.
Take it out. and let's
Yes,
vote.
8.05.
Independent counsel.
Well, Hank, no crosstalk, please. I didn't interrupt anybody else. If we could just, that's okay. In the event of a direct conflict between the county legislature and the county executive in any legal action or proceeding, the legislature may retain independent counsel by resolution. Now, if we couple that with what's already in, now again, that doesn't take away any ability that's already in the county charter for the county executive to have his own counsel. That's baked in there already in 8.05 in the preceding paragraph. All this does.
Where's the conflict?
Well, I can give you some examples of a conflict. We've had some conflicts in the past. Going back to 1991, there was an OTB, there was one in Mayapack too, but the OTB came to Putnam County, off-track betting, in 1991, and there were 2 OTB parlors put into Putnam County. One in Mahopac near Four Brothers Restaurant. It's now a liquor store, I think. And then the other one was put in at the intersection of Routes 22 and Route 6 in the town of Southeast by Brewster. And a former state legislator and the town supervisor sued the county because, again, we were in charge of placing those OTB parlors. At the time, that was part of our responsibility. The challenge is that the county didn't perform the environmental review properly. Went to court, and the court said that the county did do the environmental review properly. The county executive at the time didn't like that result, believe it or not. The legislature liked that result. The county executive at the time did not like that result. That's where at least in my memory, that's where one of the first big conflicts came up. And what happened there is the county attorney at the time was ready to challenge that case in order to say, believe it or not, we won, but we're going to appeal it. The county legislature said no, and they were ready to go out and hire their own counsel because of that conflict, and we had the power to do it back then. But the county attorney, I'll get you the news articles. I was reading them just the other day. The county attorney at the end of the day backed down and said, no, okay, we won't challenge it. The other one was with respect to, I'm trying to remember it, and it's more recent, where, again, the county executive and the county legislature disagreed, and we went out and hired an attorney. I still remember her name. I think it was Laura Zeisel. She was an attorney who was hired by this legislature because the county executive took a different position. We were able to hire our own counsel back then. And again, in that intervening time, something changed in the charter. So when we talk about conflicts, they have happened here in Putnam County's history between the executive branch and the legislative branch. The other one you talked about it was the, not Brendan case, you had mentioned it. You mentioned it in your comments.
I can go.
No, it had to do with this goes back even further. Goes back to 1986, the Lyon Capital.
Oh, yeah. Duffy
case.
The point you're trying to make is that at one time when there was a conflict, you were able to hire your own outside counsel to represent. But that's not what this is doing.
Well, this restores.
It's giving us our own. We're just retaining it full time now.
No. I'm just talking about 805. Take a look at Section 6 of this. This is the only change. I think this is the big hang-up and the change between what you had proposed and what this simply says is that this restores by charter our ability to hire our own independent legal counsel by resolution. And that is exactly what I'm talking about. We were able to do that in years past. Getting back to the Duffy case there, and it had a different part of our charter that it dealt with. It didn't have to do with, it had to deal with, in fact, something we adopted last night with respect to hiring an outside auditor. If that's your, yeah, and that's what Heather's about to point out to me. Under the charter, like we unanimously voted last night, we're hiring an outside auditor. Back into, and which is not a lawyer, I get it, it's different, but.
Oh, that's not what I was gonna say. I get it, but then I guess the question still remains with the county executive. Where is the county attorney in this now? Because it's in limbo.
No,
You
it's
understand?
still there, and I'm not trying to BS you here, I'm really not. 805, other than just adding this language, still doesn't take anything away from the county executive. He still has the ability, if there's a conflict, and the county attorney has to represent us, that doesn't even change this.
No.
The county attorney has to represent us. The county executive still is entitled to his own outside counsel paid for by the county. This doesn't change that. It doesn't take away any power from the county executive. And I'm not even going to say Kevin or Bob Bondi or Peter Al. It could be any county executive. None of that changes. This changes none of that. This simply just says.
We could go spend more money and hire our own lawyer if need be.
If need be. And I get it. And I'm a fiscal conservative too. But in those cases that I've just illustrated, had we not had that hammer, as a legislature, I wasn't on the legislature in 91, but I was down the other end of the hall in the county exec's office when this was going on. Had this legislature not had that hammer, I don't think the county attorney's office would have reversed course.
But at that time, did the county legislature have that access to the county attorney the way we do now? Because it sounds like the county attorney represented the executive then, and they were the ones who needed outside counsel. But now it sounds reversed. We have the county attorney. County executive has outside counsel.
The county attorney, even under this bill, will still remain the sole legal advisor to the county, including the county legislature.
Right, yes.
And the county executive. That doesn't change either.
Right, I know.
And that existed back then too. But back then, and again, I want to do some legislative research. Back then, I don't believe we had 135 of the county code, which I think was part of the discussion in the end of 24 and the beginning of 25, where there was an honest and honorable disagreement. There were, from what I understand, I wasn't on in 24, but at the end of the legislative session in 24, before I took office on January 1st, this legislature appointed outside counsel under their understanding of 135, Section 135 of our code, which talks about how outside counsel can be appointed. Some of that language, and I'm speaking as a legislator here, not a lawyer, so I'm not giving any legal advice. I don't want anybody to think I'm doing that. I'm just speaking as a legislator. Under that interpretation, it's a little unclear, I'll be fair. It says the county, I don't want to paraphrase it, but it says something about the county attorney either shall sign the retainer, shall sign the contract or something like that. I could pull it up. But that's the point.
I don't even think it's
I think
necessary.
that
I think
was the
we should
intervening
vote.
change. I'm probably not going to change any minds, but I want to give some of the history in the background. This, I think, fixes that, in my view. And if this does pass, we would then have to go back and clarify 135 of the code, not the charter. So that would only need 5 votes. So this is the only, from what I can see, and again, honest and honorable people can disagree, and I'm not going to say, you're unreasonable because of your belief.
Or I work for other people or something.
I won't say
like
that either, and I know you've said that about me, so I'm not going to go there either.
I'm not sure I'm not sure
but-
if I've ever been on record saying that, but that's okay.
Okay, all right. But anyway,
It says may.
it says,
It says may.
what, may what?
It says we may retain independent
Right.
legal. It doesn't say we will.
Right.
It doesn't say we have to. It doesn't say we are. It says we may.
It's up-
I
it's
think
up
we're
to-
conflicting legislative counsel with outside counsel. It's two totally separate things. Doesn't mean we're going to have a full-time
It just says
litigator
we
on
may.
staff.
It says we may. We don't have to retain the county attorney. We can, because the charter says we can. This allows us to retain outside counsel,
If.
independent of the county attorney and the county executive. That's all it says. That's what we want. Co-equal branches of government. That's what we're elected to uphold in the
Yeah.
Constitution,
The charter, right.
in the
Yeah.
charter,
All right,
and everything, and our forefathers. Rev 250.
exactly. All that fun stuff. Would anybody like to make a motion to call the question? You have a motion, sir?
Yeah, I'd like to make the motion to call the
Is
question.
there a second?
Second.
All right. I'll ask for a roll call vote, please. On this, it's yes is for this, obviously, and no is against it. And we need 6 votes.
Legislator Adamizio. Legislator Crowley. Legislator D'Angelo.
No.
Legislator Woolman.
I'm going to abstain.
Legislator Montgomery.
Yes.
Legislator Regan.
Yes.
Legislator Russo.
No.
Legislator Sage.
Yep.
And Chairman Birmingham.
Yes. Obviously, it fails. The next item is a motion to adjourn, and I'd like to make that motion with the following statement. Of course, we have 2 of our colleagues who are not here today because of losses in their family. Of course, Amy, you talked earlier tonight about a loss in your family, and we've all had losses in our families. I think it puts things in perspective for us all. There's 9 of us here, and on our tombstones, nobody's going to put county legislator on our tombstones. They're going to put loving mother and wife and daughter and son and uncle and father and grandfather and grandmother. That's the important stuff. We should always take our job seriously. Sometimes we don't have to take ourselves so seriously, and that's fine. But we should always take our job seriously, but we should also remember that, there's bigger things in life than being a county legislator and even voting on important measures like this. And sometimes it takes the loss of a family member or a loved one to remind us of that. So it's in that spirit that I'd like to make a motion to adjourn in memory of those folks of ours who've passed away, and also maybe to just keep that in perspective when we have healthy debates in the future, but realize we're all inhabiting this planet in the same way. So that's my motion. Do I have a second?
Good point. I'll second that.
Okay, thank you. All in favor?
Aye.